Okay. Anyways, so what we'll do is that we'll start off with the alcohol. Why alcohol? Because to be very honest, a lot of questions are being asked about directly or indirectly about alcohol metabolism. Okay. So whenever we are speaking of alcohol metabolism, whenever we are speaking of alcohol metabolism, so we have hand sanitizers, right? So during the lockdown, all the wine shops and all the alcohol outlets were closed. Okay, but still we had alcohol at our, that was hand sanitizer. But those who wanted to drink, did those people drink hand sanitizer? Never, right? Why didn't they drink hand sanitizer? Japan. Why? एथेनॉल इज, अरे यार दारू वही है भाई, एथेनॉल ही तो दारू है. हाँ. Some people had, and actually you are correct. Some people did drink the hand sanitizer. Okay, so please understand there are two types of alcohol which are available for us. One is ethanol, which is a drinkable alcohol. Okay, so one more is there that is called as methanol. What are the two types of alcohol which we commonly encounter? Huh? దానికే notes ఇచ్చింది. Okay, we have two types of alcohol which are commonly available. One is ethanol, one is methanol. Okay, so whenever we are speaking of ethanol and methanol, whenever the person takes either one of them, any alcohol comes into the body, there comes an enzyme which plays the role. The name of the enzyme is called as alcohol dehydrogenase. What is the name of the enzyme, everyone? Repeat, everybody. Alcohol dehydrogenase. Okay, so with this alcohol dehydrogenase plays a lot of key role. Why girls get drunk faster than boys? Girls don't get offended, sir, we have capacity and சொல்லிட்டு don't get offended. मार्क गुड कैपेसिटी ఉందని చెప్పి लड़के बुरा मत मानो, ठीक है, चलो आपका कैपेसिटी है, फिर भी जल्दी. why girls get drunk faster? Okay, the reason is that genetically girls have less amount of alcohol dehydrogenase as compared to that of male. So that is why girls will have slow metabolism of alcohol. So the effect of alcohol remains in their body for a longer period of time. Okay. Now what happens? Ethanol, which undergoes the alcohol dehydrogenase effect, and it will create something called as acetaldehyde. What is the name of the substance? Acetaldehyde. Okay. Now, when methanol undergoes the influence of alcohol dehydrogenase, it will create one more aldehyde called as formaldehyde. Okay. So, formaldehyde, it's a very dangerous substance. Why it is dangerous substance? Because again, there is one enzyme. Acetaldehyde undergoes the influence of acetaldehyde dehydrogenase, and formaldehyde undergoes the influence of formaldehyde dehydrogenase. That is not our problem. The problem is about when we integrate the same syllabus with pharmacology. So acetaldehyde under the influence of name of the enzyme, acetaldehyde dehydrogenase. Repeat, everybody. Acetaldehyde dehydrogenase. Formaldehyde under the influence of which enzyme? Formaldehyde dehydrogenase. Okay, so this both will have one of the major important role, because acetaldehyde undergoes the conversion into something called as acetoacetate. What is the name of the substance called as? Acetoacetate. Okay, so this acetoacetate will be further metabolized by the body. Okay, but when we are speaking of formaldehyde, this formaldehyde will create something called as formic acid. What is the name of the substance which will be created? Formic acid. So this is a very important MCQ from forensic medicine as well. What is the toxic metabolite which causes permanent blindness? Formic acid. Formic acid is formed as a result of what? Methanol poisoning. So what are the questions which will be asked about here is one thing they'll ask us about ethanol and methanol overdosing. They will ask. Normal, quite common thing. And the next question which will be possibly asked for everyone is going to be about formic acid. So the formic acid is the very, very dangerous to your retina. Please write down. It causes permanent blindness. It causes what? permanent blindness. So this permanent blindness, formaldehyde poisoning, methanol poisoning, when does it occur? Methanol overdose, when does it occur? कब होता है? Come on guys, tell me when will methanol poisoning occur? சொல்லுங்க. లివర్ డిస్ఫంక్షన్ అయితే గిన మెథనాల్ తాగేయంగా. ఎప్పుడు మెథనాల్ తాగుతారు? whenever there is a adulterated alcohol. Okay, adulterated alcohol. So recently in India, methanol poisoning occurred in one state. Which state? Recent. Telangana, Tamil Nadu. Okay, recently there were few people who died in Tamil Nadu due to overdose of methanol because of some adulterated alcohol. Okay, so what are the key points here? Key points is what is the retinotoxic substance formed as a result of methanol poisoning? Formic acid. What is that? Formic acid. Okay, so what is the common enzyme which plays a role? Acetaldehyde, common enzyme for all the alcohols, that is alcohol dehydrogenase. So now listen to me very carefully. If somebody drinks methanol, okay, so if somebody drinks methanol, automatically that person will be overdosed with methanol. Now how do we treat him? So basically the problem is, see, methanol, when a person drinks, methanol will get metabolized and go out of the body. Okay, but the problem is that the problem is not about the methanol. The problem is about what? Formic acid, because it is a retinotoxic substances. So we should not allow the toxicity to the retina. So if we should not allow ఏం జరగదు, it should not undergo metabolism. అంతేనా? Guys, 1 second. Okay, so basically all the ethanol, any alcohol which comes into the body will be metabolized by what? Alcohol dehydrogenase. So alcohol dehydrogenase is the enzyme which is competitively playing the role with what? For both methanol and ethanol. Okay, in which is the most toxic substance? Methanol. Methanol is the most toxic. So that is why during the methanol overdose, what will be the treatment? Gatti, by mistake somebody has drank methanol. Okay, gatti tageshindu. Okay, what will be the treatment? థైమిన్ ఇచ్చి నిద్రపోయి లేయండి. ఇట్లాంటివి చెప్తారు మంచిగా. థైమిన్ ఇస్తారా? నేనేం చెప్పిన, మెథనాల్ నుంచి వాట్ ఈస్ ద టాక్సిక్ మెటబలైజ్ ఫార్మ్డ్ యాజ్ అ రిజల్ట్ ఆఫ్ మెథనాల్? ఫార్మిక్ యాసిడ్. వీ షుడ్ నాట్ అలౌ ద ఫార్మిక్ యాసిడ్ సింథసిస్. వెన్ వీ షుడ్ నాట్ అలౌ, దట్ మీన్స్ వాట్ షుడ్ నాట్ అండర్గో మెటబాలిజం? So if it should not undergo metabolism, who should be busy? Alcohol dehydrogenase. Okay, so it is something like, if you want to destroy someone, don't go against them directly. Okay, so keep them busy with something else. Okay, what many countries does. Okay, if you want to destroy a country, right, keep them busy with the war. Give the funding, give everything, keep them busy. National wada idu. Simple as that. Okay, so like that only, alcohol dehydrogenase keep the enzyme busy competitively. Alcohol dehydrogenase automatically, if there is somebody who has methanol poisoning, if I give ethanol, automatically all the ethanol will go and bind to alcohol dehydrogenase. Methanol will get out of the body unmetabolized. Methanol will get out of the body unmetabolized. Okay, so that is a thing you need to remember. So what is the treatment for methanol overdose? Ethanol. For example, ethanol is not there in the option. Then what will you do? We are going to use a drug called as famipazole. What is the name of the drug? Famipazole. Okay, now famipazole enti? Famipazole is a type of alcohol dehydrogenase inhibitor. What is the name of the mechanism? Alcohol dehydrogenase inhibitor. Okay, so what is this alcohol dehydrogenase inhibitor? Alcohol dehydrogenase inhibitor means If at all this drug is given, it will prevent the metabolism of both methanol and ethanol. So can I use this drug for both methanol and ethanol over toxicity? Yes. So it is a dual drug. It is a drug which plays the role of treatment in both of the poisonings. Clear, everybody? All right. Let's continue to the next aspect of this thing. The same thing. What exactly the next aspect is that? So manam, when we travel in the buses, BMTC or any DTC, whatever the local transportation. Okay. I took BMTC because I am from Bangalore. So that's why I took them. ఎక్కడికి వెళ్ళినా కానీ స్టార్ట్ పెట్టిరు ఒక్క నిమిషం ఇదని ఒక్క నిమిషం దీన్ని క్లియర్ చేసి లెట్స్ క్లియర్ ద annotations. Okay. So what we are trying to do is that if at all when you go into the government buses, they would have mentioned one sticker. We have a cure for HIV. We have a cure for hepatitis B. And at the same time, మద్యపానం ఒక ప్రాబ్లమా దాన్ని మేము ఒక సాల్వ్ చేస్తాం. దే వుడ్ హావ్ రిటర్న్ ఏ నంబర్. ఆల్కహాలిజం ఇఫ్ ఇట్ ఇస్ ఎ ప్రాబ్లమ్ వి విల్ సాల్వ్ ఇట్. దే వుడ్ హావ్ గివెన్ ఏ నంబర్. సో బేసికలీ వాట్ దే విల్ డూ ఇస్ దట్ so in a rehabilitation center also if you go, they use a drug called as disulfiram. What is the name of the drug called as? Disulfiram. So this disulfiram, guys, is very simple to understand. Disulfiram is a acetaldehyde, acetaldehyde dehydrogenase inhibitor. Acetaldehyde, what is that? Dehydrogenase inhibitor. So when it is acetaldehyde dehydrogenase inhibitor, let's slowly go back and see. Guys, please understand. So this enzyme, what is the name of this enzyme? Acetaldehyde dehydrogenase. So if I inhibit this acetaldehyde dehydrogenase, after the inhibition, person will go and drink. So if he drinks, what will increase in the body? Acetaldehyde. Yes. So after taking the disulfiram, if a person drinks alcohol, what will happen to in the body? There is an increased amount of acetaldehyde. If there is an increased amount of acetaldehyde, automatically acetaldehyde is a very toxic substance which will lead to what? Which will lead to vomiting, abdominal pain, discomfort, nausea, diarrhea, and everything. So automatically person will start to develop an aversion towards the alcohol. Okay. But in reality, person will develop aversion towards the drug. Okay, that's what the reality is. Okay, but it's a type of which therapy? Aversion therapy. What is the type of the therapy? Aversion therapy. Okay, so it is acetaldehyde dehydrogenase inhibitor. Okay, so in pharmacology they will ask you a question: what are the drugs which will cause disulfiram like reaction? Means after taking these drugs, the same reactions like nausea, vomiting, etc. will occur with which drugs? Tell me, with which are the drugs? Which are the drugs? Online. చెప్పండి చెప్పండి. Guys who are present in the online batch also, tell. So wait, Chennai batch will answer this because day before yesterday only I told them about this disulfiram like reaction. Karthi. Okay, so the drugs which cause are, remember with the mnemonic PCM. What is the mnemonic? PCM. P for, repeat everybody, procarbazine. What is the name of the drug? Procarbazine. It is an anti-cancer drug. C for cephalosporins. What are the drug? Not all the cephalosporins, because cephalosporins to 5 generations are there, right? So among which there are 3 drugs. There is a drug called as cefotitan. What is the name of the drug? Cefotitan. Okay. Then there is one more thing called as cefemperazone. What is the name of the drug? Cefemperazone. And one more drug called as cefemendol. What is the name of the drug? Cefemendol. So what are the drugs we discussed so far? 4 drugs. What are those? P for procarbazine, C for three drugs. What are those? Cefamendol, cefotitan, cefaperazone, and world famous drug which causes disulfiram like reaction is metronidazole. What is that? Metronidazole. Because why we should know this as a doctor also, I will tell you. The reason is very simple. If you prescribe any drug to any of our patient, okay, na, oka 40 to 50s లో ఏజ్ ఉన్న పేషెంట్స్ కి మనం ప్రిస్క్రైబ్ చేస్తే ద కామన్ క్వశ్చన్ మెల్లగా వస్తాడు ఇట్లా అంకల్, సార్ ఏమైంది నైట్ పెగ్గేసుకుంటే ఏం కాదు, ఇఫ్ ఐ డ్రింక్ ఏ పెగ్ ఇన్ ద నైట్ విత్ ద డ్రగ్ నథింగ్ విల్ హ్యాపెన్, రైట్? His problem is genuine problem because he has been drinking alcohol for a long period of time. So that time we have to be careful while advising the patient. Okay, we have to tell them clearly. But in clinical practice, I would advise one best advice: you prescribe any antibiotic, tell them don't drink alcohol. Best idea. Okay, but as such, these are the drugs which will cause. Okay, all right. Shall we continue? So we are clear about what? We are clear about the aspect of our, what is that aspect of this thing? What is that? Our alcohol. Okay, so once we are clear about the alcohol, let's start off with the next concept. The concept is enzymes. Everyone open to the page enzymes. Students who are attending online, able to understand me, able to follow me? Yes or no? Give me a response quickly. All good? Okay, perfect. So even if you guys, I'm able to hear your audio. So even if you get it out, directly unmute and ask, because I'm sitting right next to my computer, so I can respond to you this thing or this directly itself. Okay, all of you open your pages to enzymes chapter. When we are speaking of enzymes, what are enzymes? Enzymes are basically your biological catalyst. What are they called as? Biological catalyst. Okay, now don't write all this biological catalyst and all. Those who have missed my direct classes, the full classes, I will give. Those who are online also, if you have missed my full classes, I will give my notes. Okay, no problem. So either those who are attending online, either ask to Mahesh ji or ask me directly, I'll give you the notes. మీకు ఇక్కడ నేను కౌశిక్ చెప్తాను, he'll provide you the notes, no problem. కౌశిక్, మంది ఆఫ్లైన్ ది క్లాస్ ది నోట్స్ కదా ఇచ్చేసేవా? మళ్ళీ ప్రతి ఒక్కటి రాసుకుని కూర్చోలేరు కదా. Okay, you'll not be able to write everything and sit. It makes no point. That's why. Okay, so biological catalyst means which makes any biological process to be easier. Okay, so when you take an enzyme, what are the key points which they are going to ask you? Okay, so what is an enzyme? Which helps in the conversion of one substance to another substance. So I have a chemical A. That chemical A is getting converted into chemical B with the help of what? E, that is an enzyme. Let's keep. Okay, so A is getting converted into B with the help of what? Enzyme E. Okay, so now when you take an enzyme, I want you to understand all the enzymes are proteins. All the enzymes are what, guys? Protein. So if all the enzymes are proteins, now very simple logic, proteins are made out of what? Amino acid. Okay, proteins are made out of what? Amino acid. So if all the enzymes are proteins, if they're doing some conversion, now in the protein we will have different structures, yes or no? So there are some places to bind to that protein, there are some places for functional part of that protein, yes or no? So when you take an enzyme, let's consider this is all the proteins are made out of what? This key point is very important, amino acids. Okay, why I'm telling you? Because I want you to understand a concept called as cofactor. What is that called as? Cofactor. One more is called as a coenzyme. Okay, one more wrong pronunciation will change the meaning. Okay, it's called as prosthetic group. Okay, na? Pronunciation wrong అయితే మళ్ళీ meaning will mark. Okay, what is it called as? Prosthetic group. So all the enzymes are what? Protein. Okay, along with the protein, in the structure of the enzyme itself, along with the protein, if I add anything else, so basically non-protein substance, if I add some mineral, if I add some, for example, zinc, magnesium into the enzyme, so in the structure of the enzyme itself, there is a non-protein part that will be called as prosthetic group. So prosthetic group is incorporated into the enzyme. So what is a prosthetic group, everybody? It is a non-protein part of the enzyme. It's a non-protein part of the enzyme. Okay. So if I tell you people, you should be able to tell me whether it is a prosthetic group or not. Okay. I will give you the statement. Okay. In the cytochrome enzymes, all of them contains iron in the structure of the enzyme. Is it a prosthetic group or a not? In a cytochrome enzyme, iron is a part of the enzyme. If iron is a part of the enzyme, is it a prosthetic group or not? Yes, it is a prosthetic group. Why it is a prosthetic group? Because iron is a non-protein part which is incorporated within the enzyme. There was found to have a carbohydrate group within some enzyme. It is a prosthetic group or not? Yes, it is a prosthetic. So basically, it should not be a protein, but it should be a part of enzyme. Okay. Now, what is cofactor and coenzyme? Cofactor and coenzyme are the like our friends. Manal chedagodtaru kada atlantolle illu. Okay na? So basically, what exactly is this? For example, you decided to come to Vizag, sit and study. Okay. You came to Vizag, you settled in one place, you're doing everything. Okay. One of your medical friends, MBBS friends comes to you and says, bro, we will stay together and study. Okay. But Vadu Zadadu, Mimal Zadonidu. Means he will also not study, he will not let you also study. Okay. But he is a medico. So basically, you both are from the same group. Okay. Like that only, there is one main enzyme. What is the main enzyme? Whatever hydrogenase, transferase, whatever is there, that is the main enzyme. Along with the main enzyme, there is some supporting enzyme. But they both belong to the same thing called as organic group. Okay. So that time we will call it as a coenzyme. Coenzyme is any substance which help the main enzyme. But what is the key point here? Main enzyme help just key point is it is a organic substance. It is a organic substance. Clear? Okay. But cofactor is the same thing. Help the main enzyme. But what is it? It's a inorganic substance. It's a inorganic substance. So that time we will call it as very good. That time we'll call it as what? We'll call it as a cofactor. Last year, I think I have seen a question. So they had asked, iron was required for the activation of some enzyme. Not iron, zinc, I think. Zinc was required for the activation of some enzyme. Zinc in this case scenario represents what? Option A, cofactor. Option B, coenzyme. Option C, prosthetic group. Option D, uncoupler. Answer is going to be for the activation it was requiring. It is not within the enzyme. So it is coming from outside. What is it? Cofactor. Confuse avakandi. Okay. So once we understood about that, the next point about the enzymes is going to be enzyme inhibition. So enzyme inhibition is a very, very important. All the enzyme inhibition is going to be divided into two types. Okay. What do I mean by enzyme inhibition? Enzyme inhibition means very simple. We use so many drugs, right? We use so many drugs, allopurinol, for example, NSAIDs, for example, our, what is that, anti-cancer drugs. They're going to block some enzymes in the body. If any enzyme is being blocked, that enzyme plays a role. That role will be lost. Ante kada, a enzyme ఏదైనా conversion చేస్తుందంటే ఆ conversion జరగదు. That's simple as that. Okay. But if enzyme is being inhibited, all the enzymes are what? Proteins. All the enzymes are what? Proteins. So if I destroy an enzyme forever, that enzyme is destroyed and damaged forever. Yes. But body can synthesize the new enzyme. Yes. So that is one possibility. Or I can inhibit the enzyme just for 2 hours, maybe just for 3 hours. As long as the chemical is working, till that time, the enzyme is blocked. Once the chemical is metabolized, the enzyme will become reactivated. So the permanent destruction of the enzyme and body requires a resynthesis of the new enzyme. We will call it as a irreversible inhibition. What do we call it as? Irreversible inhibition. But one more type of inhibition is there, that is only called as reversible inhibition. What is that called as? Reversible means the chemical will act for few hours. After that, enzyme will become reactivated. Then we will call it as what? Reversible inhibition. Whenever we are speaking of a reversible inhibition, in the reversible inhibition, what we are going to understand is going to be competitive and non-competitive. To understand the competitive and non-competitive, let's understand about one basic thing that is only called as places in the enzyme. That is sites in the enzyme. What are those? Sites in the enzyme, not sightseeing in the enzyme. Okay na? Malli inga akkada kuda edakandi meeru. ఎక్కడ వెళ్ళిండు మనడు ఎక్కడ సైడ్ సింగ్ చేస్తాడు okay okay now listen to me very carefully what we are telling I will consider this as a enzyme okay now when I'm considering this as a enzyme there was a substance a మరి ఏంది పజల్ పీస్ అనుకున్నా మీరు ఉంటదా మాత్రం guys it is not a puzzle piece okay it's an enzyme structure okay now when we are speaking of enzyme structure what we studied substance A was coming and binding to the enzyme E it is getting converted into substance B so the place actively conversion is taking place we will call that site as a active site we will call that site as what active site okay but there is one more area here can you notice there is one more place here where another substance can bind we will call this area as a allosteric site what do we call it as allosteric so allosteric site is a site of the enzyme which can allow the binding of some substance but which will not do any conversion so what is the active site which can also be called as catalytic site what is the catalytic site doing which will allow the active conversion of some substance. So basically it is doing its function. Okay. So what are the two sites we have? Active site and allosteric site. Okay. Now let's understand one thing. What is that called as Michaelis-Menton's constant? What is that? Michaelis-Menton constant. So what is this Michaelis-Menton constant? It's a simple thing, guys. Okay. Now please listen to me. What I'm doing is very simple as that. Okay. Normally, all the enzymes in the human body follow something called first order kinetics. And first order kinetics means basically where the amount of enzyme is not the problem, except for few scenarios. Okay. But as we want to do that, we will understand that in the format of a graph. Okay. And let's see here, we will understand the velocity of a reaction. Here we are looking at what? Velocity of a reaction in this graph. And on the another graph, what we are looking at? Time taken. What we are looking? Time. So now what happens is that in this time taken, we are looking along with the help of concentration of the substance. Okay. Velocity time. Let's remove the time itself. We will keep it with the velocity itself because velocity contains time. Okay. So concentration of the substrate. Okay. As the reaction started, if the substrate is not there, no reaction is occurring. If I bring in some substrate, reaction will occur. So the velocity will rise. As I increase the concentration of the substrate, the velocity will rise. Till when it will rise? Till the enzyme is fully saturated. Means, so there is some X quantity of enzyme. There are some 10 molecules of enzyme. Till all the 10 molecules of enzyme get saturated. Till what? All the molecules of enzyme get saturated. Till then, it will rise the velocity. But once all the enzymes are bound with the substrate, now the rate of the velocity of the reaction will come to a standstill. So it will reach a maximum velocity and remain there. It will reach a maximum velocity and remain there. So we will call this point as what? Vmax. We will call this point as a Vmax. Okay. So once we understood about that, let's understand half of the Vmax. Okay. How much is there? Vmax divided by 2. So let's take the 50% of the Vmax and plot it in the graph. Okay. So when you plot it in the graph, you get some amount of the substrate. I will call that as Km. Okay. What is Km? Km stands for Michaelis-Menten constant. What is Michaelis-Menten constant? At a 50% of the maximum velocity of a reaction, whatever the concentration of the substrate is there, I will call it as Km. So this, what I have done so far, what we have done so far is only simple thing we have done. We have only did is what? We have only did the plotting of the graph exclusively in the absence of an inhibitor. Okay. There is no computation, there is no inhibitor, nothing is there. Substrate is there, it is getting converted. If there is an inhibitor, how this will vary? Okay. So let's understand that one. Okay. So there are two types of inhibition. What are the two types of inhibition? Reversible and irreversible. In the reversible, how many types? Two types. What are those tables? Just look at the table and tell everybody competitive and non-competitive. So competitive and non-competitive, let's understand. Okay. So basically competitive and non-competitive. So I'm going to tell you in 2 point of views here. Okay. One point of view in the exam point of view for remembering. One more point to understand the logic. Okay. Now, first, let's understand the competitive inhibition. Okay. So when we are speaking of competitive inhibition, what is a competitive inhibition, guys? Very simple. Substance A wants to bind to the active site and get converted into B. Okay. But there is one more fellow who is sitting right here. He also, this person is also substance I inhibitor. This also wants to come and bind to the bind to the active. So now substance A and substance I for inhibitor, let's keep, okay? Both of them are fighting to bind to the same site. Yes or no? Yes. So how that will change? Okay. So rather than that, let's understand it in a better idea, like, way easier to remember idea. Okay. So you joined a new coaching classroom, all of. When you join a new coaching classroom, in that classroom, there was a girl. She was very beautiful and attractive. You got attracted. Once you get attracted to her, what will you do? You'll go try talk to her or something. The same thing happened for another guy. Now, originally what she wanted to? She wanted to clear her MCA exam. That was the target. Okay. In between, you both entered into the picture. Okay. What happened? One day you went and told, hey, today we'll go to beach. Nah, class is over. Time is there. Okay. She also didn't have an idea what are your intentions. She said, okay, we will go to beach. Now, what happened to her preparation? Her preparation is going faster or slower? So she's preparation became slow. Now, next day, your opponent is there. Don't forget what your opponent will do. He will also try to come and talk to her in the class. He'll tell, new movie came out, Naya movie. Chalna movie dekh. She thought, okay, I'm getting bored. Let me go. Like, she didn't have any. It went on like this. It was going on. She was preparing slowly and slowly. Okay. Here comes a biochemistry test. Okay. Which was prepared by Dr. Maruti. Definitely all three of them failed. Okay. After all three of them failed, next day morning, that day night, she realized one thing. Oh, my problem is not about lack of knowledge. My problem is about lack of preparation. Who is spoiling her? These two people. Okay. Next day morning, she'll come to the classroom and she'll, Annaya. So she'll call both of them Bhaiya, Anna. Okay. After calling them Anna, she will start to prepare. Okay. These both will become like, spoil their preparation. But at this point, slowly, as we raise the concentration of the substrate, so she will plan was what? Vmax. Okay. Vmax by half is this one. So originally what was our Km? Is this one. Okay. But in the presence of an inhibitor at the 50% of the velocity, what happened to the Km now? Km is increased. In a competitive inhibition, what will happen? Maximum velocity will be achieved, but Km is increased. Km is increased. Fill in the table. It's given already in the table. Which is in the, okay, which isn't a problem. Okay. So what is that? Km is increased. Okay. Next thing. Now, I was in that same classroom. Okay. I was their teacher. They forgot. Okay. So now she passed the FMG exam. Okay. So now her new target is NEET PG. Okay. That was the original plan. Okay. Now I saw this whole scenario. Even I am interested in the same girl. Okay. Now the scene will change. If even if I approach, she might say, brother. Okay. So I will take a different approach. I will not talk to her. I will directly go to her father. Uncle, a government job. Okay. So now her plan was to do this. Okay. So what happened? Her plan was there. It was going on and on and on and on. Okay. But at one point, uncle was impressed by government job, got us married. Okay. So now after marriage, 1 year, 1 year down the lane, first baby. Okay. Now what happens? Understand her target to achieve the NEET PG went down the drain. So what happened? Non-competitive inhibition. Now see, biochemistry plays here. I'm not joking. Okay. Think about the approach. Did I take a direct approach? No. But did I enter the target? Yes. Exactly what we are going to, what the inhibitor is going to do. Inhibitor has nothing to do with the active site. Inhibitor only approaches from a different angle, allosteric site. Okay, so this allosteric site inhibition will never achieve the maximum velocity because the enzyme activity has been destroyed. Even if you increase the, what is that? Even if you increase the concentration of the substrate. So automatically what will happen, guys? The Km remains same, but Vmax is decreased. Okay. So in exam, if you want to answer, the best way to remember is simple as that: competitive inhibition. Two people are fighting for the same thing. Remember the same story. Km will be increased, Vmax will be same. Okay. But when we are speaking of the non-competitive inhibition, in non-competitive inhibition, Km will remain same, Vmax is reduced. Understood? So this becomes a very, very important image-based MCQ for everyone. Okay. Throughout the enzymes topic, this is the very important. Understood, everyone? All right. Now, let's go to the next aspect. What is the next aspect is that there are some enzymes and their users. Okay. Among the enzymes and their users, I want you to remember few of the enzymes. How do we use the enzymes? Either we are going to use them as a diagnostic purpose or a treatment purpose. Enzymes using for the treatment purpose are less except for the pancreatic enzyme replacement. So basically we use them for a diagnosis. How do we use them for a diagnosis? First, quickly, I'll give you a theoretical idea. Then we will remember the names. Okay. Simple as that. Let's imagine a myocardial cell. So myocardial cell is a cell in the heart. When the myocardial cell dies, whatever the content present in the cell will come out, yes or no? Yes. Okay. Imagine somebody has a myocardial infarction. A group of some 50, 100, 150,000, 100,000 myocardial cells died. So when the cells die, automatically that content will be released into the blood. When that content will be released into the blood versus a healthy individual, if you compare, in a normal individual, that content will be freely present? No. But in a myocardial infarction individual, what will happen? The cells will break down, the content will be released automatically. What will be there? That enzymes or that proteins or whatever will be elevated. So there are some enzymes which are specific to a organ. Okay. Yesterday I was teaching you people one enzyme called as lactate dehydrogenase. Gurtunda? Lactate dehydrogenase is doing the same function, conversion of pyruvate to lactate. Conversion of pyruvate to lactate. But it has a different types in different organs. So LDH1, 2, 3, 4, 5. 5 types. Will like how many brothers and sisters these people are? 5. All 5 of them are doctors only, let's imagine. Okay. All of them are doing the same function, but in a different fields. Like that only, all of these enzymes are doing the same function, but at a different location. LDH1 is specifically located in the heart. If LDH1 is elevated, means heart cells are dying. Okay, let's imagine LDH5 is located in the liver. LDH5 elevated means liver injury. Like that, we have some enzymes which are used for the diagnostic purposes. So for the myocardial infarction, what are the enzymes which are used? Write down, there is something called as CPK. Repeat everybody, creatine phosphokinase. There is something called as MB form. Or this can be written as a CKMB also. CKMB or CPKMB, same thing. Okay. Then also myocardium has other enzymes. What are the other enzymes? Already here we have written AST, aminotransferase, aspartate aminotransferase is there. Along with that, I want you to write down the other cardiac biomarkers such as troponin. All of you have got this test done for one or the other patient of yours. TROP-T levels, TROP-T positive unda leda, direct blood will be collected and directly put onto the card for the emergency use. Okay. So this one, no need because it is not specific for viral hepatitis. Amylase for acute pancreatitis is a old thing, but here we have lipase. Lipase is the best investigation of choice. So what is the investigation of choice for acute pancreatitis? Remember, what is it? Serum lipase. Serum lipase. Okay, never do a serum amylase. Serum amylase, we used to do it before. Okay, we used to do it. It's not like it's not done anymore. We do it now also. But the best investigation is what? Serum lipase, because it gives a better prognostic idea than compared to that of amylase. That is why. Okay. And most importantly, more specific one is a lipase than compared to amylase. Let's go to the next one. My favorite, ceruloplasmin. Okay. So when we are speaking of ceruloplasmin, I just don't want to skip the ceruloplasmin by telling some these things. We will do it little bit depth only. Okay. Ceruloplasmin. When we are speaking of ceruloplasmin, we need to learn about two diseases, guys. One disease is called as Menkes disease. Not monkey's disease, Menkes disease. Then there is one more disease called as Wilson disease. Okay, not Winston. Okay, so what is that? Menkes disease and Wilson disease. Okay. Oh, you're thinking about Menkes. Okay, good. So Menkes and both of these ones are due to a gene defect. The name of the gene is called as ATP gene. Okay. So Menkes disease is due to defect of ATP7A. Wilson disease is due to defect of ATP7B. Okay. So if you are getting confused, remember very simple as that. M comes first or W comes first in the order of alphabets. M comes. So that is why remember it as a 7A. The next one will be Wilson. So remember it as 7B. Okay. There is no such rule, just for your remembrance. Okay. So here what happens is that here there is a deficiency of a plasma protein called as ceruloplasmin. Ceruloplasmin. Okay. Here what will happen? There is a deficiency of copper. Here, what is there? Deficiency of copper. Okay, when we are speaking of Wilson disease, in the Wilson disease, there is a deficiency of ceruloplasmin. Because of that, copper is not getting utilized. Rather, copper will start to get deposited. Deposition of copper. Deposition ఎక్కడెక్కడ జరుగుతుంది pathology? అయ్యి ఇంకా other than I. Come on, guys who are online. కరెక్టే ఉంటుంది ఎందుకు ఉండదు అయి కాకుండా ఇంకెక్కడ ఉండదా ఏమైంది దీనికి ఓ సో deposition in first liver. What will be there? Liver, which will lead to liver cirrhosis in the later stages. Okay na? Next, bronze and endo antunna bronze diabetes. Bronze diabetes is seen with the hemochromatosis in pancreatitis, in the pancreas. Okay, don't get confused, guys. Bronze diabetes is seen with bronze diabetes is not seen with copper, but it is seen with what? It is seen with iron deposition. Okay, apart from liver, in your eyes, kallallona kallu vetti chudavenduku. Okay, choose the beautiful rings. If you look into the eye, there are beautiful rings. Every guy is happy with this ring. అక్కడికి వెళ్ళి కింగ్ ఫిషర్ రింగ్ అని మార్క్ చేయమండి అంతే. దట్స్ కాల్డ్ as కైజర్ ఫస్చర్ రింగ్. వాట్ ఇస్ దట్? కైజర్ ఫస్చర్ రింగ్. Examiner, if he wants to play with you people, it's so easy. Okay, which of the following best denotes Wilson disease? Option A. Okay, copper deficiency. Option B, degeneration of he will give spleen. Option C, Kaiser Fisher ring. Option D, Kingfisher ring. The problem is that we all studied only KF ring. మనకు తెలిసిన KF ఒకటి కింగ్ ఫిషర్. Okay, na? So that becomes a problem. Okay. No, no. On the day of exam, it will become a doubtful. Oh my God, there might be some other kingfisher which I don't know. Okay. And you're going to mark the KF ring. So it's called as Kaiser Firster ring. Okay. Kaiser Firster ring. Okay. All right. Apart from that, it will also cause lentiform nucleus degeneration of that copper deposition in lentiform nucleus. ఇప్పుడు క్లినికల్ ఫీచర్ చెప్పండి అందరు మంచిగా ATP7A7B ఎవ్రీ వన్ రిమెంబర్ టెల్ మీ ద క్లినికల్ ఫీచర్స్ ఆఫ్ విల్సన్ డిసీజ్ అందరు చెప్పాలి ఆన్లైన్ స్టూడెంట్స్ ఆల్సో షుడ్ టెల్ ఎక్కడ లే అయ్యి ఇట్స్ నాట్ మెన్షన్ ఇన్ ఎనీ FMG నోట్స్ ఓకే ఫస్ట్ టైం ఐఎమ్ మెన్షనింగ్ దెమ్ as much as I remember. Okay. So now listen to me very carefully. They are going to lead to because copper deposition occurs in the brain, etc. So because of that, the child will have really irritability. Okay. Irritability. And the child is very aggressive. Okay. The child will have psychomotor agitation. ఇప్పుడు చెప్పండి. Now tell me what is a drug of choice. సార్ అటు తిరిగి ఇడకెత్తారా మీరు రాకపోతే డౌట్ పడాలి అని వస్తే డౌట్ ఎందుకు రాననుకున్నావా రాలేననుకున్నావా సో వాట్ విల్ బి దేర్ వాట్ విల్ బి ద డ్రగ్ ఆఫ్ చాయిస్ టెల్ మీ ఇన్ సెరియోలో ప్లాస్మినా క్యాప్టోప్రిల్లా దెన్ సో రైట్ డౌన్ ఏమొద్దు సీతో స్టార్ట్ అవ్వదు అది వాట్ ఈస్ ద డ్రగ్ ఆఫ్ చాయిస్ పెన్సిలమైన్ అందుకే ఓపిక మొత్తం చూడాలి ఓకేనా వాట్ ఈస్ ద ఆన్సర్ పెనిసిలమైన్ వాట్ ఈస్ దట్ పెనిసిలమైన్ ఓకే పెనిసిలమైన్ is a chelating agent for copper chelating agent for copper so this is the story of your what is that enzymes okay so all the important key factors have been covered nothing has been missed okay all right చాలు so once we have started ఇప్పుడు ఒక చిన్న బ్రేక్ తీసుకుందాం కరెక్ట్ ఉంటది సో విల్ టేక్ ఎ బ్రేక్ బికాస్ ఫస్ట్ ఒక సెట్ మనకి అటు ఇటు సెట్ అవడానికి టైం పడుతుంది ఓకేనా సో విల్ టేక్ గైస్ ఎవ్రీవన్ 15 minutes బ్రేక్ okay everyone settle up and now after the break don't come and tell me sir repeat what you did earlier ask everyone to join okay All right, guys, let's start. So, the next topic which we are going to discuss, let's go little into the slightly difficult topic. Then we'll come back to the easy ones. So, let's get into amino acids. All of you open the chapter to the amino acids. Okay. So, amino acids is a chapter which actually speaking, a lot of information is there. So we have simplified it here for the quick revision purpose. So when we are speaking of amino acids have a lot of ways to classify them. Okay. What do I mean by lots of ways to classify them? So the lots of ways to classify them is, but some of them are there. There is one thing called as based on the structure. There is one thing amino acid based on their chemical nature, based on their hydroxyl group, which I was teaching you people yesterday. Also, if you can remember, what did we discuss? Amino acids, which are simple amino acids, which are what is that? Complex, like which are branched chain amino acids, which are what is that? Sulfur containing amino acids, which are hydroxyl containing amino acids, right? So what is an amino acid? So just let me give a quick review of amino acids. Okay. So whenever we are speaking of any amino acid, the word itself is very clear. It should contain two things, amino and acid. Okay. Throughout the organic chemistry, acid means what? Acid means COOH. Okay. So what should be the group? COOH. What should be the group present? COOH. COOH means what? COOH means carboxylic group. What is the name of the group? Carboxyl group. What do I mean by a carboxyl group? Carboxyl group is an acid group in the nature. What is carboxyl? Acid in the nature. Okay. And it should also contain amino group. So it will also contain one more functional group called as NH3. So if you want to call any substance amino acid, two mandatory things which must be present. One is what functional group? NH3, and one more is what functional group? COOH. What are the two functional groups? NH3 and COOH. Repeat everybody. NH3 and COOH. Okay. So amino acid is a monomer. Amino acid is what? Monomer. What is a monomer? Monomer is a single part of a polymer as such. Okay. So now when I tell this, it becomes very technical terminology. Okay. So especially in real time, this is not a technical terminology for anybody. Okay. But when we want to apply it into the medical science, it becomes a technical terminology. Okay. We tend to confuse. So let's break down the simple structure. Let's take a wall. The wall is the example where I have used for all the classes. Okay. So wall is made out of what? Bricks. Wall is made out of what? Bricks. So a single subunit is called as a brick. All the single subunits combine together to form a structure called as wall. Yes. So single structure to form called as wall. The same way, a single part of a protein, we will call it as what, guys? Amino. So one amino acid gets attached with the another amino acid, and another that will get attached with another amino acid, that will get attached with another, that will get attached with another, that will get attached with another. So when the all the amino acids get attached with each other, we will call it as what? That is only called as protein, right? So all the amino acids combine to form protein. Okay. Now the next important aspect, what is that? The next important aspect, before I get into this important points, I want to revise all of this, okay? Because all of it is written in the notes, okay? So for you also, once again I'm telling, please don't mind. So please take the notes from here. ఓకేనా, గో త్రూ చేయండి, ఎందుకంటే ఇవన్నీ నేను చెప్పినవన్నీ మీకు మళ్ళీ రిటర్న్ గా రిపీట్ అవుతాయి. సో ఐ వాంట్ యూ టు గో త్రూ దట్ యాజ్ వెల్. ఫోటో తీయండి, ఫోటో తీయండి. అబ్బా, హేమంత్ అనుకున్నా నేను, హేమంత్ పాపం. ఇప్పుడు హేమంత్ అయితే హైలైట్ అయిపోయిందిగా, రికార్డింగ్ లో వస్తాడు. హేమంత్, యు ఆర్ ఎ పార్ట్ ఆఫ్ అఫీషియల్ రికార్డ్ నౌ. Okay, anyways, now listen to me. Okay, amino acid combines with another amino acid to form the protein. Now, when we are speaking of a protein, we have different classifications of the amino acid. If the structure is very simple, we will call it as a simple amino acid. What is that? Simple. So what are the simple amino acids we have? One is called as your glycine and one more is called as your alanine. So what are the two simple amino acids? Glycine and alanine. Okay, so simple amino acid, if I add a branching, if a single chain is there, we will call it as a simple amino. So if single chain was there, to that if I add a branching chain, then I will call it as what? Branched chain amino acid. So what are the branched chain amino acids we have? Very good. Leucine, lysine, and isoleucine. Isoleucine. LIV. That is a classic mnemonic. L for leucine, isoleucine, and val. Okay. In which this is leucine is replaced by valine? Absolutely correct. Sickle cell anemia. Okay. Anyways, so what are the three branched chain amino acids? Leucine, isoleucine, valine. Okay. Then we have sulfur containing amino acids. What are the sulfur containing amino acid? We have two of them very importantly to be remembered. What are the two of them to be remembered? So we have cysteine and methionine. Okay, cysteine and methionine. Very good. Cysteine and methionine. Okay. Then let's go to the next one. What is that? We have hydroxyl containing amino acid. Hydroxyl means OH group. OH means alcohol. So what are the amino acids which are drunk amino acids? Serine and threonine. Okay, not literally they're drunk. Basically, they contain a OH group. What name and true? Serine and threonine. Serine and threonine. Okay, so with that much being said, let's go to the next concept. Amino acid without any chiral group. Without any chiral group. Okay, what do I mean by without any chiral group? So, if a carbon atom is there, carbon valency how much? 4, because carbon can bind to 4 different substances. So if that 4 valencies are bound with the different groups, okay, chota have one place hydrogen, one place another carbon, one place hydroxyl, one place COOH, for example, I'm telling. Okay, so if it is bound with the 4 different groups, we will call it as what? Chiral carbon. So the chiral carbon is not our problem. Okay, that definition, because chiral group is a classification which we learned in the school itself. Okay, so the question they're going to ask us is which amino acid does not have a chiral group? Everybody loudly repeat. What is that? Glycine. So what is the chiral group? Non-chiral containing this thing, amino acid, glycine. Okay, so there is one more substance called as amino acid. Very good. Let's go to the next one. Amino acid. What is an amino acid? Okay, so all of us, let's look at the structure of an amino acid. What is the structure of an amino acid? There is a R group, that is a long chain of carbon atom, followed by C to be there. Okay, for example, to this NH3, if I bind with a benzene ring, let's imagine what I'm binding it with, a benzene ring. So when I'm binding it with a benzene ring, now amino group is free or it is bound to with something else? It is bound with. So when amino group is not free or if it is binding with a ring, then I will call it as what? Amino acid. What is that called as? Amino acid. What is that called as? Amino acid. What is an amino acid, guys? If a amino group is bound or amino group is not free, then we will call it as a amino group. One amino acid binds with another amino acid with the help of which bond? Peptide bond. Okay, so basically I told you people in the protein, amino acids binds with each other. If they're binding with each other, they're binding with what? Peptide bond. Okay, so that is one thing, peptide bond. Okay, if amino acid, a classic example is your proline. Classic example is your proline. Okay, let's go to the next classification, which we have already discussed. Simple amino acids are glycine, alanine. Branched chain are leucine, isoleucine, valine. Then we have sulfur containing amino acid, methionine and cysteine. Hydroxyl containing amino acids are serine and threonine. Okay. Let's go to the next important aspect. That is only derived amino acid. Keep this derived amino acid for the end. We will come back to this. Okay. All right. So what is that the next important aspect? 21st amino acid. Like usually we have 20 amino acid. Later we found out one more amino acid called as 21st amino acid. The name of the 21st amino acid is called as selenocysteine. Repeat everybody, what is it? Selenocysteine. And 22nd amino acid is called as pyrrolysine. Okay. So whenever we are speaking of that, let's get into the next important, the most important one of the cycles from the protein chapter is urea cycle. So when we are speaking of urea cycle, first let me give you a outline about the proteins and amino acids. For example, the proteins which are present in the human and the proteins which are present in a chicken, are they same? Let's take the same egg. Are they same? They are not the same. The protein which is present as whey protein and the protein which are present in our body, are they same? No. So then also we still tell that hey, chicken is a good source of protein. We tend to tell that. And we tend to take whey protein. Yes. So when we are speaking of this whey protein or anything, so proteins will come into the body. What will come into the body? Protein. So all the proteins in the intestine, they break down into amino acid. So these amino acids undergoes what? Absorption. Once the amino acids undergo absorption, the next important aspect is that your body will synthesize a new protein according to your body's requirement. Okay. So that new protein will do its function. Followed by the function of the protein, what will it undergo? It will undergo into degradation back into what? Amino acid. Once it undergoes degradation back into the amino acid, now this amino acid has been utilized already, yes or no? Which was utilized as a protein. Now this amino acid is a useful thing or a waste. So it will become a burden to the body, right? So once it becomes a burden to the body, it will become, what is that? Ammonia. Like it will have one dangerous product. What is that? NH3. That is only ammonia group. Okay. Ammonia group is a waste. So ammonia is toxic to the body. The question comes to us is what? How our body will remove the ammonia. Okay. So basically ammonia is a waste. Okay. So there is one song, popular song in India. What is that? గాడి వాళ్ళ అయ్యగారు సే కచరా నికాల్. సో లైక్ దట్ ఓన్లీ దాన్ని పికప్ చేసుకునే దానికి వస్తారు కదా డస్ట్. Like when they come to pick up the garbage, right? They play this song. Okay. So what is that? What is that? They're trying to remove the garbage. Like that only our body wants to try to remove the garbage. But where is this garbage formed? Brain la. Okay. Brain. In the brain, what is the garbage? Ammonia. Ammonia is good for brain or bad for brain? Very toxic to brain. What is that? Very, very highly toxic to the brain. Okay. Since it is highly toxic to the brain, our body wants to remove the ammonia from the brain. Okay. And the next part is that one more place which has more proteins is skeletal muscle. Our skeletal muscles will also have ammonia. They also wants to remove the ammonia. So what are the two major places from which ammonia has to be removed? See, it is removed from other organs also. I'm not saying no for that. Two major places is okay. That's why we have a saying, don't fill your brain with dirt. Okay. So brain and muscle. So in the brain, what is there? Ammonia waste product. In the muscle, what is there? Ammonia waste product. Okay. So when waste product is there, whenever you have some garbage in your house, okay, do you give the garbage to the people who pick up the garbage, or you go to the dumping yard? Will you go to the dumping yard of the city? No, you are going to give it to someone. They are going to process the garbage. Like that only, brain will give all the ammonia to a substance called as glutamine. Glutamine. So basically glutamate will take the ammonia, it becomes into glutamine. Okay. Now this glutamine will take and it go to the dumping yard. What is the dumping yard? Liver. Okay. Liver is your lover. Okay. Don't mess with your liver. Okay. Let's go to the next aspect. Muscle will also give all the waste garbage to a amino acid called as alanine. Simple, direct words to be remembered. So the transport of ammonia from the brain to the liver is done by which amino acid? Glutamate. In which form? In the form called as glutamine. Will you answer that much? Okay, perfect. The next one is what? Next one is your, what is that? That will be your muscle. From the muscle, it will bring to the liver. It is done by whom? Alanine. Okay, these two are MCQs. Okay. In the theory, I would have taught so many things. I know that how glutamate is there, how glutamine is there, what is the difference between a glutamate, glutamine, all of you have that. But the end summary, the MCQ is this much only. The transfer of ammonia from the brain to the liver is done by glutamine. The transfer of ammonia from the muscle to the liver is done by alanine. Game over. Okay. Once all that waste comes into the liver, we will call it as what? We will call it as ammonia transport. After that ammonia comes into the liver, in the liver, what it will do is that there is a cycle. The name of the cycle is called as urea cycle. What is the name of the cycle? Urea cycle. Okay, now the problem is ammonia will not be removed from the kidney directly. If I give ammonia, it will not remove from the kidney directly. If it cannot be removed from the kidney directly, so now we have to convert ammonia in such a form where it can be removed. Yes or no? So that conversion of ammonia into urea takes place by a cycle. The name of the cycle is called as ammonia or urea cycle, which is also called as ornithine cycle. Okay. So far ammonia came to the liver. In the liver, ammonia combines with your carbon dioxide. Ammonia combines with your, what is that? Carbon dioxide. When ammonia combines with carbon dioxide, the word itself is clear. I have told in every class the same thing. Ammonia and carbon dioxide. So ammonia and carbon dioxide together, we will call it as carbo and amyl. We will call it as carbamyl. What we will call it as? Carbamyl. So it will synthesize in the mitochondria of the liver cells. There is a synthesis of a substance. Everybody repeat, what is that called as? Carbamyl phosphate. What is the name of the substance called as? The carbamyl phosphate. So the carbamyl phosphate synthesis will occur with the help of what? Carbamyl phosphate synthase. That is only short formed into CPS1. So the CPS1 synthesizes carbamyl phosphate. CPS stands for what? Carbamyl phosphate synthase. This carbamyl phosphate will combine with ornithine. Will combine with what? Ornithine to give rise to a citrulline. Okay. And here is one major mistake. What can happen? Amino acid. So which amino acid responsible for the urea production? And like that, they will ask the question. I should not use these unparliamentary words to them. Okay. So those people have created some stupidity saying that aspartate is responsible for the synthesis of urea. Okay. I think he was drunk when that dash was creating the question, because this is a 149 and 150 difference making question. Okay. See, maybe there are mistakes in my notes also. I will accept that. Not like this. Okay. So citrulline combines with aspartate. Citrulline combines with aspartate. So for the citrulline synthesis, we require an enzyme called as ornithine transcarbamylase. We got, what is that? Citrulline. Citrulline got converted into arginosuccinate with the help of arginosuccinate synthase. Okay. Then we got converted into arginine. Arginine will undergo the breakdown with the help of arginase. What is the name of the enzyme? Please make the correction. Arginase. Arginase will create, what is that? Urea. Arginase will create, what is that? Urea. So that urea synthesis is occurring from which amino acid? They will ask you, what is the name of the amino acid? Arginine. Arginine. Okay. Then mistake cheyaddu. The next question they will ask from urea cycle is what? Rate limiting enzyme. What is a rate limiting enzyme? Carbamyl phosphate synthase 1, CPS1. Very good. Okay. So the next important question they will ask you is, where does urea cycle occur? If they ask you the organ, that is going to be your liver. Ledankondi, what is that? Specifically in the liver, both cytoplasm and mitochondria. Game over. That's it. Okay. So if there is a liver injury, if there is a liver injury, what will happen? Everybody tell me, if there is a liver injury. Mitochondria is not working. If mitochondria is not working, ammonia is not getting converted into urea. Ammonia is not getting converted into urea. If ammonia is not getting converted into urea, ammonia will start to accumulate in the body. Simple as that. Urea is converted by whom? Ammonia. Which converted by which organ? Liver. If acute liver injury is there, if what is there? Acute liver injury is there, that time what is going to happen? Ammonia will not convert to urea. So body will have chala amount of ammonia. Echo ammonia unte ammonia is toxic to which organ as such I told? Main toxic to brain. So that will lead to encephalopathy. Liver injury leading to brain injury because of ammonia accumulation. We will call it as hepatic encephalopathy. What do we call it as? Hepatic encephalopathy. Okay, so we will do one thing. I will try to, like, anyways, that material is there. I will try to write less, want to explain more so that the material, whatever is in the notes, I can compile it to the short. Okay, let's go to the next one. What is that? Rate limiting enzyme, we know. Amino acid, we know. Urea cycle defects. Urea cycle defects, we have two enzymes. What are the two major enzymes we have? CPS1, carbamyl phosphate synthase 1, and there is one more important enzyme. What is that? Ornithine transcarbamylase. Okay, so deficiency of type 1 hyperuricemia, type 1 hyperammonemia. What is it called as? Type 1 hyperammonemia is caused by the deficiency of which enzyme? Carbamyl phosphate synthase 1, and type 2 is caused by the deficiency of ornithyl transcarbamylase. So this is going to be important MCQ. What they'll ask you is, which of the following diseases caused by hyperammonemia, which of the following enzyme defect will lead to the hyperammonemia, type 1 or type 2? Type 1 is due to deficiency of CPS. Type 2 is due to deficiency of ornithine transcarbamylase. Clear, everybody? Okay. Let's go to the next one. What is that? That is only aromatic amino acid. What is that? Aromatic amino. So what are the aromatic amino acids we have? Aromatic amino acid we have. There is an enzyme called as phenylalanine. Okay, so when we are speaking of the phenylalanine, remember, so phenylalanine is a type of essential amino acid. Is a type of what? Essential means we have to take it from the diet. So when the phenylalanine comes into the body, it undergoes the drinking process. What is this drinking process called as? Called as hydroxylation. What is that called as? Hydroxylation. Okay, so if hydroxylation occurs, hydroxylation of the phenylalanine will give rise to tyrosine. Will give rise to what? Tyrosine. So OH group, does it comes like out of thin air? No. గాల్లో నుంచి ఇట్లా తీసుకొచ్చి OH పెట్టలేం కదా. Is it possible? It's not possible to bring. So there should be some OH donor. Okay, who will be the OH donor? That is only called as char batlodka. That OH is group is donated by tetra pack, tetra hydro biopterine. Okay, palu tetra pack palu. So tetrahydrobiopterine. This tetrahydrobiopterine, guys, will donate the OH groups. Tetra means how many? 4. So among the 4, it will donate the 2 hydroxyl groups. Hydroxyl and OH group. After donating this, it will become into what is that? Dihydrobiopterine. Right? So now we have got tyrosine. This tyrosine is responsible for the production of 3 substances. That's the most important world famous question. What is that? Catecholamines. Okay, what are the catecholamines we have? Adrenaline, noradrenaline, and dopamine. Moodutti catecholamines ane antaru. Okay na? Because all 3 of them are coming from where? Coming from the same amino acid, tyrosine. Then our thyroid hormones T3 and T4, that is also produced by what? Tyrosine. And most confusing and every year asked question, that is melanin. Correct? No sir. Abba, barkichiru. So what is that? Melanin. So melanin is produced. Okay, melanin is responsible for the, very good, melanin is responsible for what? Melanin is responsible for the production of pigmentation of the skin and the hair. Okay na. Next, it is tyrosine is an amino acid which is present in one important protein called as glycogenin. Okay, but the problem is that glycogenin molecular structure has been studied, but there are some refusal statement which are occurring. So because of that, we don't include into proper classification. But as such, if they ask about glycogen, they're asking tyrosine. Can we continue? Okay. So if at all hydroxylation is occurring, who is undergoing hydroxylation? Phenylalanine. So with the help of which enzyme? Phenylalanine hydro. If phenylalanine hydroxylase is not there, phenylalanine will not get converted into tyrosine. If tyrosine is not there, no melanin, no T3, T4, there is no catecholamines. If there is no T3, T4, this is occurring from the time of conception of the baby. Yes, of course. So that means no T3, T4 properly produced from the birth or before the birth itself. Before the birth, during the time of fetal development itself. Okay. So because of that, burra edagadu, there is no development of the brain. Okay. And one more thing, melanin is not there. Melanin is not there. Very light skin, pale skin. Okay. And blonde hair. Okay. So most of our graduates are from Russia and Ukraine. Okay. So blonde hair and pale skin. Is there common thing what they have seen for 6 years of their life? Okay, in both male and female. చెడిపోయారు మీరు అన్ని ఇట్లాంటివే ఓకేనా సో both male and female I'm telling. Okay, so the problem here is that so very blonde person will be there, but if you go near them, very bad smelling, because phenylalanine enters the urine in the form of something called as phenyl ketones. What is that called as? Phenyl ketones. Phenyl ketones. So that is due to genetic deficiency of which gene? PAH gene. What is PAH? Phenylalanine hydroxylase gene. So that will lead to automatically T3, T4 is not there. No brain development, but looking very beautiful, but without brains. Why? Because no T3, T4, mental retardation. What are the clinical features of phenylketonuria? Mental retardation. ఇంకా అన్ని చెప్పు, అదే చెప్పు మళ్ళీ 10 సార్లు. బాగున్నావు కౌశిక్ నువ్వు అట్ట కాదు. సో మెంటల్ రిటార్డేషన్, పేల్ స్కిన్, బ్లాండ్ హెయిర్ అండ్ దగ్గరికి వెళ్తే mousy odor. Why? Because of the phenyl ketones. So these are the clinical features of your phenylketonuria. వినిపించదు నాకు అప్పుడప్పుడు, చెవులు మంచిగా. So let's go to the next one. What is that formation of T3 and T4? Formation of T3 and T4. There is an image, but I don't like that image. Okay. So తెలుసుగా మనది ఎలాగుంటుందని, ఇమేజ్లో నచ్చవు మనకి. నేను చెప్పిందే మాకు నచ్చుతుంది. ఓకేనా, నాకు ఆ కోలానే కావు. ఓకే, నౌ లిసన్ టు మీ వెరీ కేర్ఫుల్లీ. Let's consider this is the thyroid gland of a person. Sara thyroid gland ledu, lekpoyina ga nandu. Okay, it looks like a thyroid. Okay, so in the thyroid gland, they are called as small circles called as follicles. In the follicles, we will take one follicle. If you look into the follicle, we will have some epithelial cell. So inside this follicle, whatever content is there, we will call this content as. So let's take one follicular epithelium. So when I take one follicular epithelium, okay, so on this follicular epithelium, what do we have? We have two sides. So one side is your colloid is there. Yes. And the another side is the external surface of the epithelium. Antena? So on the external surface, there is one receptor. The name of the receptor is called as TSH receptor. So which receptor? TSH receptor. So this TSH receptor will get stimulated by what? Thyroid stimulating. When thyroid stimulating hormone stimulates the TSH receptor, automatically it will produce a substance called as thyroid globin. Okay, globin is a type of globulin. Globulin is nothing but Protein. Yes, all the proteins are made out of what? Amino acid. So this thyroid globin will come into what? Into the colloid. So in the thyroid globin, we have an amino acid called as a tyrosine. What is there? Tyrosine. Okay. So now, on the other hand, what will be going on is very simple to understand. So there is one specialized symporter called as N for sodium, I for iodine, S for symporter. We will call it as a NIS. Okay. ఇవన్నీ మీ నోట్స్లో ఉన్నాయి. మళ్ళీ ఇంకా సార్ ఇది రాయలేదని నాకు కంప్లైంట్ చేయకండి. ఓకేనా? సో NIS. What is NIS? Sodium iodine symporter. So sodium iodine symporter will take the sodium, a positive ion, will take the iodide or iodide, which is a negative. So this iodide can be transferring from external cell to internal, but this iodide will get converted into iodine. Will get converted into what? Iodine. Okay. Iodine వస్తుంది, అది it will be converted into iodine. Okay. So what will be there? Iodine will come. So this conversion of iodine to iodide to iodine, we will call it as religious. So getting married, that is basically trapping. Okay. So we will call it as iodine trapping. Okay. So once iodine is trapped, ఇంకా తప్పింది కాదు, సంసార జీవితంలోకి వెళ్ళాల్సిందే. So basically iodine, once it is formed, this iodine will enter the colloid, with the help of what, sir? With the help of somebody called as pendrin. What is it called as? Pendrin. Okay. So because of the pendrin, what has come into the colloid? Iodine. So this iodine combines with tyrosine, which is present of the thyroid globin, with the help of an enzyme called as TPO. What is TPO stands for? Thyroid peroxidase. Very good, guys. Okay. TPO, that is thyroid peroxidase. So this TPO will give rise to monoiodotyrosine. Further, with the help of TPO only, diiodotyrosine. Okay. Then it will get converted into triiodotyrosine. Okay, na kani then atla rayal meaning will mark. So what is it called as? Meaning will become wrong. Why, you know? Because tetraiodotyrosine is T4. Triiodotyrosine is T3. For both of them, if I short form into TIT, it will become a confusing information. Kaha ho ji? Okay. So it is only your T3 and T4. What is that? T3 and T4. Okay. So the T3 and T4 will be released as required for the body. Clear, everybody? All right. Understood? Camera adutunna. Which part, ma? ఏం లేదు, చెప్దామా ఏముంది. So there is a follicular epithelium. Follicular epithelium has a receptor. The name of the receptor is called as TSH receptor. That will be stimulated by a thyroid stimulating hormone. That will lead to production of thyroid globin. That thyroid globin is a protein. That protein will come into the colloid and wait. But in that protein, one amino acid is there, tyrosine. And on the another side, sodium iodine symporter is there. That sodium iodine symporter will take up the sodium, will take up the iodide, and iodide will become into iodine. This process of conversion of iodide to iodine is called as trapping. It's like a getting married. Okay, getting trapped. Okay. Once iodine is formed, iodine will enter the colloid with the help of a specialized channel called as pendrin. So that pendrin will allow the entry of iodine. Iodine combines with tyrosine, creating monoiodotyrosine, diiodotyrosine, triiodotyrosine, and tetraiodotyrosine. For this tyrosine, tetraiodotyrosine to form, we require an enzyme called as thyroid peroxidase. That is only short formed into TPO. Whenever body requires more amount of thyroid hormone, that will be released from the colloid. Okay. Photo తీసుకో. Why do you want to waste your energy? Seriously. మీరు రివిజన్ లో కూర్చొని మంచిగా వినడానికి అంతే. ఫోటో తీసుకో. ఇది మొత్తం రాసిన పీడిఎఫ్ నేను ఇస్తా. డీటెయిల్డ్ గా రాసిన పీడిఎఫ్ ఆల్రెడీ ఉందిగా మీ దగ్గర. మళ్ళీ గ్రూప్ మే भेजो जी. क्या करते हो आप? లేకపోతే ఇంకోటి పంపుతా. కొత్త 4 ఉన్నాయి నా దగ్గర, ఏం ప్రాబ్లం లేదు. ఓకేనా? లెట్స్ గో టు ద నెక్స్ట్ ఆస్పెక్ట్. So now please listen to me. These are the pure biochemistry concepts. Apart from that, what are the correlating concepts which can be asked? I want you to go through very carefully about hyper and hypothyroidism. Hyperthyroidism, clinical feature and diagnosis. Hypothyroidism, clinical feature and diagnosis. And next important thing they'll ask you is something called Wolff-Chaikoff phenomenon. What is the phenomenon name called as? Wolff-Chaikoff phenomenon. What is a Wolff-Chaikoff phenomenon? सर वुल्फ भाई चाय दागिंदी అది చాయ్కోఫ్. वुल्फ जाके चाय पिएगा तो चायकोफ हो जाएगा. No, not like that. It's a scientist name. Please listen to me, guys. Wolff-Chaikoff phenomenon is a scientist. Wolff-Chaikoff is a scientist. Okay? What happens? For example, let's imagine a person who was exposed to a large amount of iodine suddenly. Large amount of iodine suddenly. So now thyroid gland will become saturated with the iodine. Means it will take up all the iodine, it will become fully saturated. Once the thyroid gland becomes saturated, once what becomes saturated, everybody repeat, thyroid. So when thyroid gland becomes saturated, thyroid gland paradoxically responds. Maybe it will respond excessively, or maybe it will respond, what is that? Stop the production of thyroid hormone. Usually what happens is that it will stop the production of thyroid hormone. Okay, so sudden exposure to large amount of iodine will stop the production of what? T3 and T4. Okay, it's basically causing the constipation to the thyroid gland. బయటకు రానియట్లే ఏంటి? ఏం రానియట్లే? T3, T4. What it's not allowing to come out? T3, T4. Why? Because there is a large amount of iodine. So large amount of iodine whenever exposed, what will happen? T3, T4 production will stop. We will call it as what? Thyroid constipation. Okay, so don't answer in the question saying that constipation is caused because thyroid gland is stuck in the rectum of a patient. Okay, thyroid gland is not stuck in the rectum of a patient. Then in Telugu translate cheyakanడి, meaning will మారిపోతుంది. బాగున్నారయ్యా, ఏంది ఇది? Okay, now listen to me very carefully. What is that? Thyroid constipator. So is it useful for us? It is very much useful. Let's imagine a patient who wants to undergo thyroid surgery. When a patient wants to undergo thyroid surgery, what we are going to do? We are going to cut open the thyroid gland. Put thyroid gland cut cheste, we are going to cut the follicles. Follicles are filled with what? Thyroid hormone. So suddenly large amount of thyroid hormone will come. So as a complication of thyroid surgery, what can happen? Thyroid storm. Lots of amounts of thyroid hormone. So now it is a problem or not? It's a problem. So can I prevent it? Yes, if you want, if the surgeon attended my class, definitely he can prevent it. Okay, what he has to do? He has to plan the surgery and he has to call the patient just few days before the surgery, give some iodine containing drug. So once he gives the iodine, automatically thyroid will undergo constipation. It would have stopped the production of T3 and T4. When you cut open the thyroid gland after a week, it is not going to be a problem. So Wolff-Chaikoff phenomenon is useful in what? Prevention of thyroid storm. ఓకే, ఇట్లాంటి స్టేట్మెంట్స్ కావాలంటే అక్కడక్కడ మెన్షన్ చేసుకో, కావాలంటే చేసుకో. ఓకేనా? సో ప్రివెన్షన్ ఆఫ్ థైరాయిడ్ స్టార్మ్. సో ప్రివెన్షన్ ఆఫ్ వాట్ స్టార్మ్? థైరాయిడ్ స్టార్మ్. వూల్ఫ్, WOLF. చాయ్కోఫ్, CHAIKOFF. Absolutely, large dose of iodine is a constipator. Constipator of what? Thyroid gland. మళ్ళీ పోయి థైరాయిడ్ గ్లాండ్ ఇరుక్కుంది సార్ అనకండి, మళ్ళీ నాకు గుండె ఇరుక్కుంటుంది. Understood everybody? All right, good. So once you understood that, let's go to the next aspect. What is that? That is melanin. Melanin is produced by melanocytes. Melanin is produced by which cells in the body? Melanocytes. Okay, so when we are speaking of the melanocytes, all of you attended the full-fledged classes, so you should know this. But anyways, melanin is produced by melanocytes. Okay. Those who are attending online only for rapid revision, for you people also, I'm telling you, very simple. Even if you have not attended pure hardcore biochemistry, I'm going to come. Okay, but since about the rapid revision program, we might constrain about correlating it to the others. Okay? లేకపోతే మనం రేడియాలజీలో దుమ్ము లేపుతాంగా బయోకెమికల్ రేడియాలజీ కూడా చెప్తాం. అది different story. Okay, now let's go to the next aspect. What is that? Melanin. Melanin is produced by which cell? Melanocyte. Which cell? Melanocyte. So when we are speaking of melanocyte, melanocytes are present in the skin. Yes, melanin is produced. Yes, it is responsible for the pigmentation. So basically we have an amino acid. What is amino acid? Tyrosine. That is, tyrosine is formed by an enzyme called as, everybody repeat loudly, tyrosinase. What is the name of the enzyme called as? Tyrosinase. Okay, so tyrosinase deficiency leads to which disease? Albinism. And what will happen? Failure of migration and autoimmune destruction of melanocyte. Most common cause is autoimmune destruction of melanocyte. Melanocyte destroy అయితే ఏమొస్తుంది? Vitiligo. What will be there? Vitiligo. So both of them, let me give you a clinical picture of the patient. So this is a classic example of what? Everybody online tell who is this person. So what is this? This is a case of, what is that? Vitiligo. Hindi రావట్లేదు అక్క అక్కాయ్. ఓకే, షేర్ చేసి పడండి. ఎవడైనా దీన్ని స్క్రీన్ చేసి, if anybody takes this screenshot and puts, I'm gonna kill you people. Okay, so this is a classic case scenario of what? Vitiligo or albinism, because blonde hair and the blonde face. Okay, but when we are speaking of next scenario, what is this? This is a case scenario of what? Vitiligo, because there is a patchy depigmentation. Okay, महेश जी, इसको ठीक ठाक पोर्ट्रे कर देना, नहीं तो ये लोग फिर मेरे साथ मजे ले लेंगे. Okay, all right, let's continue to the next aspect. What is that? That is only your, what is that? Albinism and vitiligo. So if the vitiligo is what? Patchy depigmentation. First image which I showed, complete body depigmentation, we will call it as what? Albinism. Okay, గుర్తుకొచ్చిరా ఎవరని కౌశికు? మనోళ్ళు చెప్పింటారు, ఆన్లైన్ లో చెప్పింటారు మనోళ్ళు. So sir, is a very good question. Sir, is there any treatment for vitiligo? Okay, so vitiligo and for the albinism, as such, there is no cure, my dear students. Okay, so there are some drugs which are being tried, and there are some, like, phototherapy type of managements, but as such there is no cure. Okay, ట్రీట్మెంట్ కాదు, అది కాస్మెటిక్ అపియరెన్స్. దాని ట్రీట్మెంట్ అనలేము, బికాస్ మెలనోసైట్స్ ఇస్ నాట్ జస్ట్ అబౌట్ కాస్మెటికల్ అపియరెన్స్. కాస్మెటికల్ అపియరెన్స్ అంటే మనం కూడా మొత్తం మెలనోసైట్ అని చంపేసుకుని హాయిగా మనం కూడా తెల్ల లెక్కన తిరగచ్చుగా, తెల్లగా. అది తిరగలేం. వై ఇట్ ఈస్ నాట్ పాసిబుల్? ద రీజన్ ఈస్ సింపుల్ యాజ్ దట్. సో దట్స్ ఎ కాస్మెటిక్ అపియరెన్స్. ఎస్పెషలీ దే డోంట్ డూ ఇట్ ఆల్ ఓవర్ ద బాడీ. దే వుడ్ డూ ఇట్ మేబీ ఫేస్ ఆర్ మేబీ వేర్ ఇట్స్ రియలీ ఆక్వర్డ్. ఓకే, సో దట్ ఈస్ అ పాసిబిలిటీ. ఓకే, all right, let's continue to the next aspect. Tyrosine ardhamainda. Let's go to the next one, synthesis of catecholamines. I don't like this image also. Okay, let's teach you the whole thing. Yesterday I told you people, repu nenu maatladedi nenu cheppetappudu chepta anna kada, gattiginandi mari. So the next one we are going to understand is catecholamines. What are the catecholamines which are present in the body? Everybody tell me loudly. Adrenaline, noradrenaline, and dopamine. Very good. So we have an amino acid, tyrosine. What is the name of the amino acid? Tyrosine. Tyrosine is already drunk or not drunk? When phenylalanine drinks alcohol, that is adds the OH group, we got a tyrosine. Yes? Already drunk? Mardanki inkoncham iddam. Okay, we will give one more alcohol. So who is undergoing alcohol? Alcoholic is undergoing alcoholism. So if it is like, if you trouble the trouble, trouble troubles you. Okay. So like that, if OH group added, who is going on hydroxylation? Tyrosine hydroxylase. No problem. Troubles are trouble dialogue. Everyone will understand. My students from Chennai also will understand. Balai Babu is famous everywhere. Okay. So the next one is now who is drunk 2 times? Who has added the OH group 2 times? 2 times. Tyrosine 1 time took the alcohol. Before tyrosine, phenylalanine took the alcohol. So totally phenylalanine was the original amino acid which has drank 2 times. That is why I will call it as dihydroxyphenylalanine. That is only called as dopa. Pharmacology. In pharmacology, I taught you people levodopa. The same dopas, levo structure is manufactured in the drug form called as levodopa. Understood? Oh. So that dopa will undergo the influence of an enzyme called as DDC, not BBC. Okay. BBC News Channel. Okay. So that is dopa decarboxylase. What is that? Dopa decarboxylase. It will give rise to dopamine. It will give rise to dopamine. Now this dopamine again, see these people are very alcoholics. It will undergo hydroxylation once again. In better manner. Repeat. Okay. So what exactly is happening here is that we have a tyrosine. So tyrosine comes from phenylalanine. Phenylalanine undergoes hydroxylation 1 time to give rise to tyrosine. The tyrosine undergoes hydroxylation. So basically phenylalanine was the original structure which formed a tyrosine. Tyrosine undergone hydroxylation once again. It will give rise to a substance called dopa. Tyrosine, with the help of tyrosine hydroxylase, it will create dopa, that is only dihydroxyphenylalanine. The dihydroxyphenylalanine under the influence of a dopa decarboxylase enzyme, which is present even in the brain and the periphery of the body, it will give rise to dopamine. Dopamine again drinks. So this is like drinking game of tyrosine. Okay. So this will undergo alcohol dopamine hydroxylase. So it will give rise to noradrenaline. What is that? Noradrenaline. So noradrenaline is formed in almost all the sympathetic neurons, guys. Where it is formed? Sympathetic neurons. Even in your autonomic nervous system pharmacology also, they will ask you, you have to know that norepinephrine is formed by sympathetic neurons. But in the adrenal medulla, where in the adrenal medulla, the noradrenaline which is formed will undergo a process called as addition of a CH3 group. Okay. CH4 is called as methane. Agree with me? CH4 is called as methane. Like that only CH3 is called as methyl group. So if methyl group is being added, the name are methylation. What do we call it as? Methylation. Karthik Purunjada? Kadama Kaushika, Kadama Karthik. Okay. Now listen to me. Noradrenaline. Noradrenaline will get converted into what? Adrenaline. So the production of adrenaline occurs only in adrenal medulla. So that is why when there is a adrenal rush, you are focusing, you are always concentrating, telling about which gland? Adrenal gland, but not about the other sympathetic neurons. Okay. So what are the three catecholamines which are formed? What are the three catecholamines which are formed? What are them? Dopamine, noradrenaline, adrenaline. So noradrenaline, dopamine formed in both the places, adrenal medulla also and also neuron. But in the adrenal medulla, exclusively formed one is what? In adrenal medulla, exclusively formed one is adrenal. Okay, now adrenal medulla, if it is forming this, now let's understand if at all there is, if at all there is a problem. What is the problem called as pheochromocytoma? Okay, so this pheochromocytoma, దీన్ని మీరు కావాలంటే రికార్డ్ కూడా చేసుకుని పెట్టేసుకోండి. Okay, so this pheochromocytoma, I will give all the important points in a short form. Okay, now listen to me, because writing them is gonna take a long time. Just in few seconds, just don't write anything, just listen. Pheochromocytoma. నారడ్రినలిన్ అడ్రినల్ గ్లాండ్ కి వెళ్ళిన తర్వాత ప్రొడ్యూస్ అవుతుందా, లేకపోతే నారడ్రినలిన్ గ్లాండ్ లోనే ప్రొడ్యూస్ అవుతుందా? ఇఫ్ ఐఎమ్ నాట్ రాంగ్, నారడ్రినలిన్ ఇస్ ప్రొడ్యూస్డ్ ఇన్ ద అడ్రినల్ గ్లాండ్ ఆల్సో. అంటే ది సేమ్ ప్రొసీజర్ టిల్ నారడ్రినలిన్ విల్ అక్కర్ బోత్ ఇన్ ద న్యూరాన్ అండ్ యాజ్ వెల్ యాజ్ ఇన్ ద అడ్రినల్ మెడ్యులా. బట్ వన్ ఎక్స్ట్రా స్టెప్ ఇన్ ద అడ్రినల్ మెడ్యులా ఇస్ కన్వర్షన్ ఇంటూ కెటకోలిన్స్. దట్ ఈస్ అడ్రినల్. ఓకే, అంతేనా? Okay, now listen to me very carefully. What is that? That is your pheochromocyte. First question, what is pheochromocyte? It's ending with oma. It's a type of tumor. Okay, it's usually a type of secretory tumor. Which type of tumor? Secretory tumor. If it is a type of secretory tumor, it is a most common originating place where it originates is adrenal medulla. Where it will originate? Adrenal medulla. Most common site is, repeat everybody, adrenal medulla. So this in the adrenal medulla. But is there possibility for the tumor to be present outside of adrenal medulla? Yes. So what is the criteria which we have to look for? The tumor has to be catecholamine secreting, specifically adrenaline secreting tumor. Adrenaline secreting tumor, what do we call it as? Pheochromocytoma. So this pheochromocytoma can be adrenal or extra. This extra adrenal or adrenal tumor, depending on the location, it might create a surrounding organ related symptom. But common symptoms which will be created is what? It is a secretory tumor. It is secreting what? Adrenaline. If adrenaline is secreted, adrenaline will activate which nervous system? Sympathetic. So sympathetic nervous system, if it will activate, whenever more adrenaline, what will be produced? Sympathetic activation, because of which tachycardia. Okay, that patient will tell us a palpitation. And the next question they're going to ask you is, what are the other clinical features? That includes elevated blood pressure, occipital headache, and also patient will have hyperglycemia, because adrenaline is excess. Adrenaline excess will cause the activation of what? Sympathetic nervous system. Sympathetic activation will cause the activation of beta 2 receptors in the liver. Activation of beta 2 receptors in the liver will cause glucose production. Understood? That is second. The next important point, all these symptoms are going to be episodic or a paroxysmal. Means they are present all the time, or they will come and go. They will come and go. So whenever tumor becomes active excessively, that time more adrenaline, that time symptoms will come. Maybe 30 minutes, 40 minutes, that episode will be there, disappears. Because of this disappearance and appearing again and again, it's just a palpitation and hyperglycemia. Hyperglycemia, they're not going to notice. They're going to notice only palpitation and headache. They think that it might be panic. Patient might think that it is just an anxiety. It will be there for some time, it will disappear. Now the question comes to us is, how do we diagnose it? These patients will never come and see the doctor directly saying, sir, yesterday 2 minutes I had palpitations and also headache. They're not going to come like that. Yes. So for that purpose of missing the diagnosis, the textbook of Bailey and Love has written one beautiful statement. Not a beautiful statement, to be very honest, a very frank statement in the tabular column of pheochromocytoma on the 27th edition. Okay, what is that they have mentioned is, diagnose the patient before the death. Diagnose the patient before that, because most of the time the patient will have this pheochromocytoma, their accidental finding or maybe autopsy findings. Okay, so what is elevated? Adrenaline. Adrenaline will activate alpha receptor, causing the elevated blood pressure. So if you find the case, we are going to give what is that? Phenoxybenzamine. What is the drug of choice? Everybody repeat. Phenoxybenzamine, because it's not related to biochem, but still I want to recuperate the whole thing. Phenoxybenzamine. If the phenoxybenzamine is the drug of choice, but along with the phenoxybenzamine, they might ask you, what is the drug to be added? The other drug to be added is propranolol. What are the two drugs which can be used together? Repeat everybody. Phenoxybenzamine and propranolol. Very good. So they are used to control the elevated blood pressure. But if there is a tumor, what is the primary treatment? కోసి కారం పెట్టాలి అంటారు కదా. సో యూ హ్యావ్ టు కట్ అండ్ remove the tumor. So you have to resect the tumor. Resection is what? Resection of the tumor is a treatment of choice. అర్థమైందా? సో resection of the tumor followed by that, if there is some remnant, control it with the drugs. Okay, ఇది pheochromocytoma. Why you are telling about pheochromocytoma? Because how do we diagnose the pheochromocytoma is a key point, because there is a elevated level of adrenaline. So all this adrenaline, noradrenaline, everything, catecholamines will break down themselves into one simple substance called as metanephrine. So ఇప్పుడు catecholamine పెరిగితే మెటానెఫ్రిన్స్ పెరుగుతాయి. So more metanephrines will automatically will enter into the urine. So elevated level of metanephrines in the urine in a 24-hour period of time is a investigation of choice for what? Pheochromocytoma. కానీ the problem is what? Pheochromocytoma అవుతుంది. ఓకేనా? So it is like terrorists are there, but where they are? Like that pheochromocytoma is there. Where is it? We don't know. We have to search for it. Where we are going to search for it? With the help of radiological images. Usually we prefer MRI, but MRI is not a gold standard investigation. The best gold standard investigation which is followed right now, one of the best we have is MIBG scan. Okay, GG. MIBG scan. What is that? MIBG scan. Okay. So it is a type of nuclear scan. Okay. PET scan ekkada vaadtaru? Metastasis, distance metastasis or a nearest metastasis? Distance metastasis. Okay. Okay. ఇప్పుడు ఇంకా వస్తాయి ఇప్పుడు స్కాన్ అని పట్టు మన ఆక్ట్రియోటైడ్ స్కాన్ ఇస్ యూస్డ్ ఫర్ అట్లాంటిది ఇన్నే లేదా? ఆక్ట్రియోటైడ్ స్కాన్ కమన్ గా ఇస్తా ऑनलाइन। ऑक्ट्रियोटाइड स्कैन क्या बात करते जी? ఆక్ట్రియోటైడ్ స్కాన్ ఇస్ యూస్ ఫర్ ఇట్లాంటివి రాసుకోరు మీరు. ఆహా తెలియగలరు. పక్కన ఒక బాక్స్ వేసి రాసుకోరా. ఆక్ట్రియోటైడ్ స్కాన్ ఇస్ యూస్డ్ ఫర్ గ్యాస్ట్రినోమా. సార్ గ్యాస్ట్రినోమా ఏడు ఉంటుంది మాకు తెలియదు. there is a triangle called as gastrinoma triangle. ఆడనే ఉంటది. Okay, anyways, gastrinoma, VIPoma. What is a drug of choice for gastrinoma? What is a drug of choice for VIP? This one, insulinoma. What is a drug of choice for VIPoma? ఇది కూడా కంప్లీట్ చేసేద్దాం. Right down. So students who are attending online also, this is absolutely out of syllabus, but still for gastrinoma, what is a drug of choice? For all the tumors, the treatment of choice is remove the tumor. So gastrinoma, drug of choice. Then VIPoma, drug of choice. Okay. Then the next one, which one? Insulinoma. చెప్పండి. ఇక్కడతో అయిపోతే ఎందుకు? ప్రొలాక్టినం కూడా రాద్దామా? వద్దు, ఇంకా దెబ్బ కన్ఫ్యూజ్ అయిపోతుంది. కరెక్ట్. సో గ్యాస్ట్రినోమాకి PPIs are the treatment. Aggressive PPI therapy. Aggressive PPI therapy. VIPoma చెప్పండి. Insulinoma, you can tell me. Actually, if you are read my pharmacology notes, it is written in that. టీతో వస్తుంది కానీ మీరు అనుకున్నది కాదు. Diazoxide. What is that? Diazoxide. VIPoma ka octreotide. VIPoma octreotide. వాసో ఇన్హిబిటరీ పెప్టైడ్ అనే హార్మోన్ ని ప్రొడ్యూస్ చేసే ట్యూమర్. ఓకేనా? వ్యాలిడ్ క్వశ్చన్. నో వ్యాలిడ్ క్వశ్చన్. ఫస్ట్ టైం నన్ను అడిగినా కానీ నేను కూడా అలా అంటున్నాను. సార్ వాట్ ఈస్ విఐపి? విఐపి ఇస్ ఏ వాసో ఇన్హిబిటరీ పెప్టైడ్. ఓకే, దీనివల్ల డయేరియా వస్తుంది. వాసో ఇన్హిబిటరీ పెప్టైడ్ అయిందా? ఇన్సులినోమా, డైజాక్సైడ్, ఇన్సులిన్ ప్రొడ్యూసింగ్, గ్యాస్ట్రినోమా. ఓకే, ఇంకా స్కాన్ లో మెకల్ స్కాన్ ఎక్కడ వాడతారు చెప్పండి తొందరగా. మెకల్ స్కాన్ ఇస్ యూస్డ్ ఫర్ అబ్బా నేను ఇంత గట్టి చెప్తున్నా. Meckel's diverticulum. Okay. What is the element or a radionucleotide used in the Meckel scan? Online students, скажите, пожалуйста, что это такое? Никого не знает этого? Вообще, вообще ноль. Okay. This is technetium pertechnate. Technetium pertechnate is the radionucleotide used in the Meckel scan, and the same technetium pertechnate can be used in the thyroid gland also. It can also be used in the tumor which is associated with what? Tumor of the salivary gland called as Warthin's tumor. అన్నిట్లో తిన్నాం అయిందా పోదామా ఇక థైరాయిడ్ గ్లాండ్ వార్తిమ్ ట్యూమర్ సలైవరీ గ్లాండ్ ట్యూమర్ ఇంకా చెప్పాలా మూగా స్కాన్ ఎటు పడతారు మూగా స్కాన్ మూగపోయిన మనసులా ఓకే మూగా స్కాన్ ఇస్ యూస్డ్ ఫర్ వెంట్రికులర్ ఫంక్షన్ హార్ట్ వెంట్రికల్స్ పనిచేస్తున్నాయా లేదా ఎంయుజిఏ ఇవన్నీ ఏడున్నాయి సార్ అని తిట్టుకుంటున్నారా రాసుకోండి ఎనీవేస్ వీఆర్ రైటింగ్ మూగా స్కాన్ ఇస్ యూస్డ్ ఫర్ ఆన్లైన్ స్టూడెంట్స్ ప్లీజ్ రైట్ ఆన్ మూగా స్కాన్ ఇస్ యూస్డ్ ఫర్ ఫంక్షన్ ఆఫ్ ద వెంట్రికల్స్ then let's go to the next one anyways we are doing the scan. Let's play with the scans. So okay, we have time, no problem, no worries. Okay. Then next scan, thallium scan is used for ventricle function. రాసుకోండి అది థాలియం కాదు, అది గ్యాలియం. Again ventricular function was gallium 67 on which garland sign will be seen. Pathology, radiology చదువుకున్నారుగా గార్లాండ్ సైన్. ఇప్పుడు మీకేస్తే అక్కడ గార్లాండ్ నేను తీసుకొచ్చి ఐ విల్ పుట్ వన్ గార్లాండ్ ఆన్ ఆల్ ఆఫ్ యూ. ఇప్పుడు మన క్లాస్లో అటెండ్ అవ్వకుండా మనకి మిస్ చేసుకున్నారంటే పర్లేదు, మీరు అటెండ్ మిస్ చేస్తే ఎట్లా? ఫర్ యూ పీపుల్ ఆల్సో వర్ అటెండింగ్ ఆన్లైన్, యూ పీపుల్ ఆల్సో అటెండెడ్ ద రేడియాలజీ క్లాస్, రైట్? టెల్ మీ. See, answer came. Very good, Akash. Very good. Sarcoidosis. ఇప్పుడు ఆయన మీద వేయలేదు, దొరికిపోతారు. చాలా ఇంకా మేము జగాల. Okay, gallium 67, garland sign. It is seen in sarcoidosis. Write down everybody. Sarcoidosis. Very good, Akash. Correct answer. Okay. Meckel's diverticulum, salivary gland tumor, that is Warthin's tumor, దాని పేరు Warthin tumor. ఇంకొకటి మన ఇది థైరాయిడ్ గ్లాండ్. అంతేనా? Here? Okay. Radio iodine scan. RIU used in. RIA కాదు, RIU. Radio iodine uptake scan. U ఉంది అక్కడ. థైరాయిడ్ గ్లాండ్. Radio iodine uptake scan is also used for thyroid gland. PET scan లో వాడే రేడియో ఐసోటోప్ ఏంటి? సెస్నా ఫ్లైట్ వస్తుంది ఇట్లా, సెస్నా డ్రర్ అని వస్తుంది. దట్ ఈస్ ఓన్లీ కాల్డ్ as fluorodeoxyglucose, FDG. నిన్న 10 సార్లు చెప్పించిన FDG, 18 fluorodeoxyglucose. దాన్ని మెన్షన్ చేసుకోకుండా వదిలేసేయండి, బికాస్ వీ హ్యావ్ దట్ ఇన్ కాల్. ఓకే, జస్ట్ ఒకలాగా స్కాన్ వచ్చింది కదా, మొత్తం అన్నీ అయిపోగొట్టేద్దాం అని చెప్పి. ఓకేనా? ఇంకేమైనా స్కాన్లు మిగిలినాయా? MIBG అయిపోయింది, పియోక్రోమోసైటోమా. ఓకేనా? లెట్స్ గో టు ద నెక్స్ట్ వన్. Let's go to the next important aspect, that is metabolism of tyrosine. So among the metabolism of tyrosine, please remember, so throughout this process, I don't want you to remember the whole process. So when tyrosine has done its function, it has to get metabolized and get eliminated from the body. When it has to get eliminated from the body, in the intermediate stage, it forms a substance called as homogentisate. That homogentisate is metabolized by an enzyme called as homogentisate oxidase. Okay, it is not homosexual, it's a homogentisate. It is a homogentisate oxidase. Okay, so the point which we have to remember is deficiency of homogentisate oxidase will lead to alkaptonuria. What is the name of the disease called as? Alkaptonuria. What is the name of the disease called as? Alkaptonuria. What is alkaptonuria? Deficiency of homogentisate oxidase. What is the name of the disease? Homogentisate oxidase. So that will lead to, what are the clinical features we are going to get? Black urine tarvata, very good, black urine vastadi, inkem vastadi. So black urine, so please, you people are absolutely correct. I want to improvise that knowledge of yours. Okay, so that black urine, the urine will not come out from the body black. This is what you need to understand. On standing ante em ledu, when the urine exposed to the air, this homogentisate in the urine will get oxidized, so that is only exposure to air that will lead to oxidized. So that will lead to what? That will lead to what? Black colorization of the urine. And next important thing, that is only called as achronosis. అక్కడ రాని సిమ్టమ్ వచ్చేదే ఆక్రనోసిస్. ఇట్లాంటి ఇస్తాడు వాడు, తెలివైనడు, తాగిపోతాడు. So what he'll give? Achronosis. Achronosis is nothing but pigmentation around the ear cartilage and the mouth. Okay, తర్వాత బ్లాక్ కలర్ యూరిన్ అండ్ స్టాండింగ్ అందరు చెప్పేస్తాం. ఓకేనా, యూరిన్ ని స్మెల్ చేసి చూసిండు అంటాడు పాపం. He wanted to smell the urine, so it is like burnt sugar smell. అసలు ఈ బయోకెమిస్ట్రీ వాళ్ళు, pathology వాళ్ళు కలిపి, both biochemistry people and pathology people combined together have ruined a lot of things for us. Chocolate cyst. After looking at the chocolate cyst, drink a hot chocolate. Real one, not the radiological images. Okay. Anchovy sauce. amoebic liver abscess. Pasuni anchovy sauce. Pancakes మీద maple syrup urine disease. అది కూడా పర్లేదు, that is also fine. Main thing you forget. Okay, curd like appearance coagulative necrosis. TB లో వస్తుంది. దాని తర్వాత కర్డ్ తినండి చూసింది. వెజైనల్ క్యాండిడియాసిస్, కర్డీ డిశ్చార్జ్. ఇంకేం దొరకలేదురా నీకు కంపేర్ చేయడానికి. ఓకే, సో దట్ ఈస్ బర్న్ షుగర్ స్మెల్. అండ్ నెక్స్ట్ వన్ ఈస్ ఇది ఇంపార్టెంట్. ఇట్లాంటివి రాసుకోండి. టెండినైటిస్. What is that? Tendinitis. Write down students online. Tendinitis. Okay, so that's present, but still when you're going through, this will be sufficient. Okay, let's go to the next important aspect. The next important aspect out of all the amino acids is this much I have said. There are some amino acids which is not written here, which I will go through very quickly and tell you people the important points. Okay, so for that, what you have to do? Use that extra pages of notes, papers. Okay, so the first one, sulfur containing amino acids. So what is the sulfur containing amino acids? Methionine and cysteine. Methionine. Okay, now listen to me. I will explain the whole procedure, but in that only one table is important, which I have explained yesterday. We will develop on that material also today. Okay, so all of you remember noradrenaline getting converted into adrenaline. Students online, please don't miss this out. Don't write, it's okay, it's already present in the notes which you have written, so no worries. Those who haven't attended my class, write down. If you have not attended and have the PDF also, don't write this down. I want you to understand this process, that's it. Okay, so adrenaline to noradrenaline to adrenaline. During that time, we are doing one process called as addition of the methyl group called as methylation. Agree with me? Yes. So when we wanted to do hydroxylation, I told you people, hydroxyl group will be donated by whom? Donated by whom? Tetrahydrobiopterin. Like that methyl group also should have a donor. Yes, sir. So that methyl groups come from where? Okay. So before going that methyl group, let me give you one basic mathematical calculation. Okay. We have somebody called as methionine. We have somebody called as methionine. In that, I am going to minus something. I am going to minus a CH3 group. So when you remove a methionine minus, when you remove a CH3 from methionine, I will get what is that? Homocysteine. Okay. If I remove a methyl group from the methionine, I will get what is that? Homocysteine. Okay. Now apply that same math calculation. Homocysteine plus CH3. Then it will become what? Everybody should tell me. Homocysteine nunchi what we did here, methionine nunchi, from methionine what we removed? CH3. We got homocysteine. To that homocysteine, if I give it back, what will happen? Methionine. That's it. Pakka repeat cheyamani. Okay. So now if you understood this calculation, the logic is very simple. Okay. Okay. Now let's continue to the next aspect. What is that? So noradrenaline is there. Noradrenaline requires a methyl. There should be somebody to donate the methyl group. Antena? So who will donate the methyl group? There will be one bhaiya. That bhaiya name is called as Sam bhaiya. Okay. So everyone will have one Sam bhaiya in their life. Okay. Directly or indirectly. Okay. Even I had one Sam bhaiya in my studying. Okay. So that what is Sam? Yes. Adenosyl methionine. What is that called as? Methionine. Okay. If Sam bhaiya sees this, he's gonna roast. Okay. So what is that? Yes, adenosyl methionine. Okay. Yes, adenosyl methionine will get converted. Basically, it donates what? CH3. Ardhamainda? CH3. So it donated a CH3. So from the methionine, what did I remove, Sarji? What did I remove? Methyl group. So if I remove a methyl group, what will I get? Homocysteine. But it is in the form of S-adenosyl form. I will get a S adenosyl homocysteine. Okay. So homocysteine. Now homocysteine S-adenosyl. So this S-adenosyl homocysteine will get converted into homocysteine. Okay. Now please listen to me very carefully. I'm going to teach all of you a new concept called as derived amino acid. Okay. So till now, normally, is there any amino acid? Methionine is there. This methionine is coded always by genetic codons, right? Methionine has a coding. Methionine has a coding that is called as AUG. Okay. Tyrosine had a coding. Okay. Phenylalanine has a coding. But who doesn't have a coding, you know? It is not coded by any codon. A amino acid which is not coded by any codon, if it is still an amino acid, we will call it as a derived amino acid. Ilantivi biochemical process, throughout the biochemical process, lot of them will come across. Okay. One of them is homocysteine. So what is a homocysteine? Example for derived amino. So now the classic example, I will give one more. We have an amino acid called as proline, sir. Very good. Correct, Sangeet. Okay. We have proline. So proline is present in the collagen. But proline, after the collagen forms, it will get converted into hydroxyproline. You people scold the drinkers. Full body is drinking. Okay. Collagen also, without drinking, it is unstable. Okay. So proline has to undergo hydroxylation. if anybody uses this as a reference and start drinking, I'm not responsible. I didn't teach biochemistry. Okay, so we have hydroxyproline. Okay, now hydroxyproline is an amino acid. Yes, sir. Hydroxyproline is an amino acid. But hydroxyproline, does it have any codon? No. But only which had a codon was proline. Understood? So that is also called as a derived amino. So the classic example for the two derived amino acids are homocysteine and hydroxyproline. Proline and చెప్పకూడదు ఎందుకంటే proline has codon కదా. So which one is there? Hydroxyproline. Everybody repeat loudly. Examples for derived amino acid. మీరు ఎంత మంచి రిపీట్ చేస్తే అంత మంచి గుర్తుంటది. ఓకేనా? ఎందుకంటే బయోకెమిస్ట్రీ ఇది ఇట్లా వస్తుంది అనమాట. వస్తుంది ఇట్లా కమ్ లైక్ దిస్. కాస్త ఇట్లా ఫస్ట్ 1 hour ఇట్లా రిపెల్ అవుతుంది. తర్వాత కొంచెం పెనిట్రేట్ అవుతుంది. Penetrate, after penetration, it will start to boil. After boiling, it will become vapor and it will go out in the form of smoke out of it. So if you want to retain all of it here only, repeat it. Okay. లేదంటే మళ్ళీ క్లాస్లో వేసిన డబుల్ మీనింగ్ జోక్లు అన్ని గుర్తుపెట్టి అన్ని పనికి వస్తాయి. ఓకేనా? ఓకే, లెట్స్ కంటిన్యూ. So hydroxyproline and homocysteine are the classic example for derived amino acid. What is that? Derived amino acid. Are they coded by any codon? No. Ante that means these are not some big people. They are there. Okay, simple as that. This homocysteine, but homocysteine is not happy. So that homocysteine wants his methyl group back. So that methyl group is there. That methyl group will be added. So that methyl group will be added and it will become a methionine. It will become methionine. That methionine will become into SAM again. Clear? Understood everybody? Okay. So now we have a question. Abba, here you are telling it will come out of thin air or what? Here who will give the methyl group? Yes or no? Valid question. That's a genuine question. So for that only, whatever the food we eat, right? That consists of B9. That B9 is called as folic acid. Folic acid is the donor of methyl group. Especially which type of folic acid? Ask only. Everybody write down which type of folic acid. Very good. Which type of folic acid? Methyl. Methyl tetrahydrofolate. Malonic acid ఎందుకైతే folic acid కదా మనకు వస్తుంది. ఎస్సగా కసికో కదా. So basically methyl tetrahydrofolate. If I am the examiner, right, I will give the whole thing. Which of the following is the source of methyl group for homocysteine? Option A, vitamin B9. Option B, folic acid. Option C, no, tetrahydrofolate. Option D, methyl tetrahydrofolate. దెబ్బకి నేల కదుపుని వస్తారు ఇట్లా. ఓకేనా? సో బికాస్ everyone has written as B9, but B9 లో there is a form. In the B9 குள்ள ஒரு form இருக்கு. அந்த form பேர் என்னன்னா folic acid ல methyl tetrahydrofolate. In the methyl tetrahydrofolate will donate the methyl group to whom? Homocysteine. समझ में आ गया? So after that methyl donation, it will become into tetrahydrofolate. So basically this methyl group is being transferred from whom to whom? Folic acid to homocysteine. So that is why we will call this enzyme as homocysteine methyl transferase. Okay. Methyl. So because of that, for this enzyme to work, this is a main enzyme. All the main enzyme require supporting enzyme. That supporting enzyme is B12, sir. The supporting enzyme is B12. That is only cyanocobalamin. So now let's imagine if B9 is not there, homocysteine will not get converted into methionine. If B12 is not there, homocysteine transferase will not work. Homocysteine will not get converted into methionine. In B9 and B12 deficiency, in B9 and B12 deficiency, what will be elevated? Increase of homocysteine. Okay. నాకేమైంది? So what is that? Homocysteine. But very good. Then next one, in the B12 deficiency, there is an increase of homocysteine, and also there is an increase of your favorite acid. What is that? Methyl melanoic acid. Okay, na? Happy now? Final gachindadi. Okay. What is that? Methyl melanoic acid. Yeah, if anybody is getting confused, okay, that is not mixed martial arts. Okay. So please listen to me very carefully. What I'm trying to tell you is, manaki, we have to clear the X. If you are getting confused, how many numbers are there? Two numbers are here. So both are elevated. How many numbers are here? One number is here. So only one will be elevated. So in benign deficiency, only one is elevated. Okay. So rather than confusing this with adding, let's put it like this. Okay. So benign deficiency will have only elevated homocysteine. So remember it as single digit, single one is elevated. Clear everybody? So that finishes your amino acids. Okay. Break this kunama. In time? 2కి వెళ్దాం లంచ్ కి. మనం ఎంతసేపు స్టార్ట్ చేసాం? ఎగ్జాక్ట్ 11 చాలు బ్రేక్ తీసుకున్నాం. విల్ టేక్ 20 minutes బ్రేక్. సో 12:20 అయింది, 12:40కి వద్దాం. 12:40 నుంచి 2 వరకు చేద్దాం. విల్ డూ ఇట్ టిల్ 2. At 2 we will take a lunch break till 2:15. 2:10. లేదులే, మరి అంత దారుణం ఏం చేయండిలే. All right, everyone. Students who are online, join back. We'll start the class. So till now, what we discussed was about amino acids. Okay. Next discussion is going to be about proteins. So let's start off with the proteins. Okay. So among all the proteins, for our revision program, the most important protein is a structural protein. Is which one? Structural protein. Okay. So before starting the structural protein, so for all of you, I'll give you a basic idea about proteins. Okay. So proteins are classified based on multiple ways. Okay. One is based upon their structure. Okay. If they're very simple and a straight chain like this, they're very simple and a straight chain like this, we will call it as what? We will call it as a primary. Okay. So this simple straight chain attached with one more chain, I will call it as a secondary protein. I'll call it as. So this secondary protein, for example, let's imagine it got twisted like this. It got what is that? Twisted like this. Then I will call it as a tertiary protein. I'll call it as a tertiary. But the same protein took the proper structure and a shape into something. We will call it as a quaternary protein, not a quarter protein, quaternary protein. Okay. So what is that? Quaternary protein. So what are the types of protein? Primary, secondary, tertiary, and quaternary. Among which is the most complex structure? Quaternary. What is that? Quaternary. So they, among all of them, they might ask you something called as beta plated sheets. Okay. So what is that? Beta plated sheets. So beta plated sheets is nothing but, what is beta plated sheet? It is nothing but the first time in a protein structure where multi-layered structure arrives. Okay. So one sheet attached with the another sheet. When will it come for the first time? Is it primary or secondary? Primary is a single line like this. Yes. Okay. So when is it occurring? Yes, Mani, you're absolutely correct. Secondary protein. What is that? Secondary. So when we are speaking of secondary proteins and tertiary proteins, we understood based on the structure, based on their location. They can be located in the plasma. We will call it as a plasma protein. They can be located in the testicles. We can call it as a testicular protein. Okay. They can be located in the connective tissue. We will call it as a structural protein. Structural protein. It is providing the complete support structure to the body. Okay. So like that totally, what are the structural organs we have? Bones, muscles, blood vessels. Okay. Na malli inga nadumulu inga migilinani eskomanandi. Okay. Na? So basically we are talking about these ones. Okay. So among which what you need to know, guys, is very simple thing. A structural protein which is present all over the body. The name is called as collagen. The name is called as collagen. So in the collagen, we have multiple types of collagen. Okay. In that, I'm going to discuss only four types. Okay. So this collagen, చెప్పండి మరి pathology నుంచి myofibroblast, when it will be formed? చెప్పండి. Myofibroblast is a type of cell which is formed during the secondary intention of healing. During what? Secondary intention of healing. So in the collagen, we have types. One is called as type 1 collagen. Type 1 collagen is located in the places such as ligaments, bone, dermis of the skin, and tendons. Where they are located? Ligaments, bone, dermis, and tendon. So if there is a defect in this protein, we are going to get a disease, very important disease called as osteogenesis imperfecta. What is this osteogenesis imperfecta? There is an improper growth of the bones, which is more common in what? Male or female gender? Females. Anni males మీదనే దోషి బాగున్నారు మీరు అబ్బా అన్ని ఒప్పుకోం మేము ప్రతిసారి మా మీద వేసేస్తారు. Okay, so they're more common female babies as compared to that of male babies. Okay, So the main problem is other bones might be developed. Main problem in this case scenario is pelvic bones are not developed properly. So improper pelvis development, and they will have a color of the sclera. Blue color sclera. You're absolutely right. So there will be blue sclera. Sir, they will look, so for them, everything will look blue color. Movies also. Okay. No, not like that. Sclera is blue. Their sclera is blue. Okay. We are not talking about iris color. Okay. Iris color, I think, na? Oh my God, what a beautiful blue eyes anachu. Ikkada sclera is a blue color. Okay. Blue color sclera. Blue color sclera is seen with which disease? Osteogenesis. So they will look at everything as blue color. No, not even films. Okay. So in the same way, when we are speaking of color changes, let's talk about jaundice. Okay. Jaundice, they will look at every object which will be perceived as yellow color. Wrong answer. The person who is with jaundice, they will have yellowish color in them. Okay, because of the pigment. Okay. Cyanosis will be which color? Bluish color. Urine will be red color in which disease? And not which drug use, and tears will also turn into red color. Rakta kanneeru. Rifampicin. What is that? Rifampicin. Okay. Body will turn into red color called as red man syndrome seen with vancomycin. Okay. So, రెండు సబ్జెక్టులు నేనే ఫ్యాకల్టీ, నేను రెండింటిని వేసుకోవచ్చు, ఏం ప్రాబ్లం లేదు. ఓకేనా? సో then vancomycin is a red man syndrome. Baby will turn into gray color, which is not clinically used anymore, is a chloramphenicol. It's a gray color cyanosis. Are absolutely correct. Okay. So blue color sclera, pelvis is improperly developed. So let's go little bit depth into orthopedics and give me the deformity which is there. Cheppandi mari. Congenital talipes equinus varus. Okay. Congenital talipes equina varus deformity. Where rum kaadu malli, rum ante meaning maaripotadi, because the rum versus rum and varus rendu okkate. Okay na? Gummu rummu different. Okay. Anyways, then actually that is just applicable only for the knee joints. Okay na? Ikkada untundi. Cubital varus deformity. Cubital varus deformity means what will happen? Tell me in which disease cubital varus will come? Absolutely correct. Gunstock deformity seen with supracondylar fracture of the humerus. Okay. So what is there? Varus deformity. Your elbow joint will go away from the body. It will come like this. Okay. It looks like a gunstock. Anyways. Okay, supracondylar fracture, absolutely correct. Type 2 cartilage is present. It's present in the cartilage, will lead to chondral dysplasia. Type 3 collagen is present where? In the aorta and one more place. Where is that? Kidney kaadu, skin. Where is it located? Skin. Okay. Where is it located? Skin. Very good. Absolutely correct, guys. Okay. If it is located as in the skin, so you might have seen this few people doing all this weird martial arts. Okay. So can you touch your thumb to the back of the hand? Untaru chaala తెలివైన వాళ్ళు. ఓకేనా? So they will tell what? Can you touch your thumb to the back of the hand? Okay. Some people will do this, all this Nagin dance. What they will do? So they will get their hands reverse like this and they'll get it normal. Okay. So they are extra flexible. Okay. They are extra flexible. Okay. Either they are very well trained from the childhood or they are diseased. Okay. They are not extra stretchable. Extra stretchable ante inkememo cheyochu. Okay. So anyways. So extra stretchability might arise because of the defect of collagen. Okay. One of the such kind of diseases. Some people will tell, look at this. I can stretch my skin so much. If I try to do this forcefully, either I'm pinching my carotid artery so bad, or if my carotid artery misses, after punching, it will become like some love bite here. Okay, hickey. Okay, so now the problem is there's extra stretchability comes from the collagen defect. That collagen defect is type 3 collagen defect. It's called as Ehlers-Danlos syndrome. Okay, all right. Let's continue to the next one, type 4 collagen defect. Type 4 collagen defect is called as any basement, where it is located, any basement membranes. Where is it the basement membranes are there? Basement membrane concept, when I say as a basement membrane separately, we will get confused. Okay, any epithelial cell, any endothelial cell. Manam, if I want to draw an epithelial cell, will I just draw the epithelial cell like this? No. First rule in the line. After the line, cells will come. So that line is signifying what? That's a basement membrane. Okay. So basement membranes are located where? All over the body, requiring based on the epithelium. But if at all, if it is defective, automatically it will be defective for what? It will be defective in the capillaries. Capillaries, so one of the biggest capillaries is which one? Glomerulus. What is that? Glomerulus. What is that? Glomerulus. So automatically glomerulus will become defective. Glomerulus is responsible for the filtration. Now what can happen is that the patient will have a proteinuria because basement membrane is defect. It will appear as a glomerulonephritis. Okay. Then lens is also having a connective tissue. If at all that is defective, there will be what is that? Anterior lenticonus. Anterior lenticonus. So here lens will be anteriorly curved. Okay, ఇక్కడ కన్ఫ్యూజ్ అవుతారు చాలా మంది. Anterior lenticonus versus keratoconus. Keratoconus అంటే cornea is having extra curvature. Okay, cornea is having a extra curvature. ఓకేనా, ఇది ఇది తప్ప పండుగ నా శాశ్వత సర కూపన్ మరబడి అన్న ప్రచన్న. So keratoconus is a corneal, what is that? Cornea is having a extra angle. Okay, yes, you are absolutely correct. Okay, cornea is having a extra angle. So if lens is having extra curvature towards the anterior side, then we will call it as what? Lenticonus. Lenti in the ophthalmology represent as a lens. That is one of the terminologies used. Okay. Then we have a SNH, sensory neuronal hearing loss. Okay. So the next one is, if at all glomerulonephritis is there, usually we take a biopsy of the kidney for the diagnosis. We end up finding an appearance called as basket wave appearance. Okay. So one of the most commonly asked questions will be this one. Okay. There is a effacement of the food process of the podocyte, they'll ask. Effacement of the food process of the podocyte is seen with which condition? Which type of glomerulonephritis? It is seen with minimal change disease. Which disease? Minimal change disease. Okay. Then it is a type of inheritance. It is a type of X-linked inheritance. Which type of inheritance? X-linked inheritance. So that finishes our all the important points from the proteins and amino acids. Okay. So once we are done with the proteins and amino acid, let's go to our world famous vitamins. Okay. So in here, what we are going to do? Okay, what we are going to do is very simple. Guys, 1 second, please listen to me. In this table, we are going to fill only one thing. What we are going to fill is, what is the vitamin deficient? What is the disease caused? Maybe important clinical if it is feature is there, we are going to fill that. But what I'm going to do throughout this filling this time, what we will do is that we will discuss the entire disease as itself. And in that, we are going to add this. Okay. కౌశిక్ అక్కడక్కడ చెప్తా, చిన్న చిన్న ఒక్కొక్క వైటమిన్ ఒక్కొక్కటి వీడియోలో తీసి పడేసి మళ్ళీ ఏం చేయంటే అన్ని గ్రూప్లో పెట్టేసి వాళ్ళు మీరు కావాలంటే మళ్ళీ నోట్స్ అయినా చేసుకోవచ్చు, లాస్ట్ మినిట్లో మీరు చూసుకుైనా చూసుకోవచ్చు, ఈజీగా ఉంటుంది. ఓకే, లెట్స్ స్టార్ట్ ఆఫ్ విత్ ద వైటమిన్స్. ఆల్ ద వైటమిన్స్ ఆర్ క్లాసిఫైడ్ ఇంటూ 2 types, fat soluble and water soluble. So please listen to me very carefully. Fat soluble vitamin absorption requires, fat soluble vitamin absorption requires what? Fat absorption. Simple as that. Ante kada? Fat absorption requires what? Bile acids. Fat absorption requires bile. So any condition, if bile acids are not coming to the intestine, then automatically we will call it as a deficiency of fat absorption. Fat absorption deficiency, vitamin deficiency, such as, sir, can you give some example? So you might have studied in a condition called as choledocholithiasis. Choledocholithia, where there is a stone in the gallbladder, bile duct. There is an obstruction of the bile duct. Obstruction of the bile duct will not allow the bile to come into the intestine. If bile is not coming into the intestine, automatically what will happen? Bile acids are not coming. If bile acids are not coming, fat will not get absorbed. If fat will not get absorbed, fat soluble vitamin deficiency. If fat is not getting absorbed, fat should enter the GIT. It has to exit the GIT. If fats, undigested fat exiting from the GIT, we will call it as steatory. అర్థమైందా ఏమంటారు? Steatory. So fat soluble absorption always requires what, sir? Fat soluble vitamins absorption always require fat absorption. Fat absorption always require bile acids. Okay, due to any condition, if there is obstruction, they can directly or indirectly cause a fat soluble vitamin deficiency. Okay, so if at all they tell you this is going to be extreme level of clinical scenario when they are comparing the absorption related question, okay, they will tell you a 35-year-old female with steatorrhea, having abdominal pain, fever and jaundice. Okay, immediately your brain went into which triad? Charcot's triad, and your brain is roaming around the surgery. That caused the impairment of fat absorption, which can lead to which of the following vitamin deficiency? In that they will give one fat soluble vitamin, but our brain is roaming around the surgery. Okay, so be very careful. Okay, first vitamin A. Vitamin A is a vitamin which is also called as retinoic acid. Okay, retinol. If it can be alcohol form, it can be aldehyde form, it can be acidic form. Okay, so during all these case scenarios, vitamin A deficiency will lead to which disease? So the common clinical feature is xerophthalmia. Xerophthalmia. Which condition it will lead to? Xerophthalmia. Xerophthalmia is nothing but dryness in the eye. So dryness in the eye will be there. So this dryness in the eye will followed by nyctalopia, night blindness. Okay, night blindness. Okay, and also guys, this xerophthalmia, please remember one important concept here. Along with the xerophthalmia, there is a WHO classification of vitamin A deficiency that is represented by X. Not your ex-girlfriend, it is X stands for xerophthalmia. It stands for what? Xerophthalmia. So xerophthalmia, it is divided into multiple stages. XN, there is one stage. Okay, XN stands for nyctalopia. Okay, then there is X1. Okay, so X1 will have two stages, X1A, X1B. Okay, X1A, there is only conjunctival xerosis. X1B is the specific term bite hotspot. Okay, so let's be like, since we know it, let's make it more accurate. Okay, na? So X1B is what? Bite hotspot. So bite hotspot, till now bite hotspot, they used to ask very simple question. Bite hotspots are seen with which vitamin deficiency? Okay, now all the students started to answer vitamin A. Now examiner became brilliant. Bite hotspot is made out of what? Next attempt, that question became very difficult. Okay, but it is not difficult for us, at least after this point of time. So bite hot spots are seen with vitamin A deficiency, and it is made out of keratin. It's called as hyperkeratotic spot. Hey, super money. Okay, so what is that? Hyperkeratotic spot. Okay, that's a very important. Let's go to the next one. Vitamin D. Vitamin D deficiency. That will lead to what? Two diseases. One is osteomalacia. Okay, na? Osteomalacia. Seen with the female more commonly or male more common? ఎవరు ఎక్కువ ఓవర్ యాక్షన్ చేస్తారో వాళ్ళలోనే ఉంటుంది. మీరే ఆన్సర్. దీన్ని మళ్ళీ అన్ని లాంగ్వేజ్లో చెప్పి. ఇట్ ఈస్ మోర్ కామన్ ఇన్ విచ్ ఫీమేల్? అదిగో వచ్చేసిరుగా. వెరీ గుడ్ కార్తిక్. Very good. Answer is female. Why? Because compared to men, they are less exposed to sunlight. Reason number one. Reason number two. When men drive a bike, this is not the direct reason. I'm just telling it as a context for understanding. When men drive bike, first manam em chestam, shirt will be folded, button will open up, titta cheskuni, then we will start our bullet. If girls are driving a scooter, that's different. gloves, another gloves, scarf which covers eyes also. I feel like they're not seeing the road sometimes. Not everyone. Huh? Again, don't come in the comment section and kill me. Okay, or in the video section, don't raise the complaint. But not everyone. Some people. So much, like this much only visible. Eh, are you seeing? That's the problem. Okay. Covered from the sun. No sunlight is there. I want to put SPF for 5,000, not 50. Nowadays they want 5,000 SPF minimum. Okay, na? 5,000 ledu. 5,000 is not there. But still expectations. Okay. So after that, the end, it will be like 1 mm thickness. Okay. 70 mm real laga. Okay, na? So that much thickness, preventing and pushing away the ultraviolet radiation. Now, ultraviolet radiation is required for activation of vitamin D synthesis. That is one thing. And more importantly, let's be very practical and realistic. Okay, let's not roast the girls. Okay, so let's not roast them. So, to be very honest, our lifestyles have changed. How they have changed? Many people are doing a night jobs, right? Many people are doing a different types of shift of duties. So that will prevent them from exposing to sunlight. Proper time లో బయటకు వెళ్ళాం మనం డాక్టర్లు మన బతుకు అంతే నైట్ మొత్తం డ్యూటీ చేస్తాం పొద్దున్నే బయటకు వెళ్దాం కరెక్ట్ ఈవినింగ్ వెళ్తాం మందు కొట్టద్దు అట్టుంటుంది మన పరిస్థితి అవునా సో దట్ ఈస్ ద ప్రాబ్లమ్ విత్ దిస్ ఓకే ఎనీవేస్ వైటమిన్ డి deficiency in adults will lead to osteomalacia. In X-ray we are going to find something called as loser zones guys. Loser zone. Loser zone is also called as pseudo fracture. Write this down, pseudo fracture. It looks like a fracture, but it is not a fracture. Okay. In the children, what will happen? Very good. Rickets nunchi, they're asking some simple questions. Now, rickets clinical features I'll explain. So vitamin D is not there. If vitamin D is not there, calcium absorption will not occur from the intestine. Calcium reabsorption will not occur from the kidney. Clear? Understood? Okay. Calcium absorption ekkadi nunchi jaragadu? Intestine. Calcium reabsorption ekkadi nunchi jaragadu? కిడ్నీ నుంచి ఎప్పుడైనా కానీ రీఅబ్జార్ప్షన్ అనే టర్మ్ వాడేది మనం ఇక్కడ కిడ్నీలో ఓకేనా సో లెట్స్ కంటిన్యూ సో వెన్ వీఆర్ స్పీకింగ్ ఆఫ్ దిస్ లూజర్స్ సారీ రికెట్స్ ఆర్ వైటమిన్ డి సో వైటమిన్ డి అబ్జార్ప్షన్ ఇస్ నీడెడ్ సో వైటమిన్ డి is forming like allowing the calcium. If vitamin D pulling the calcium into the body, it will help in the bone growth. Yes, baby's bone growth require lot of minerals. Yes. Now the baby growth will be delayed. So first clinical feature, inka miru extra like if somebody does not have a notes for vitamins, raskuntanante cheppe clinical features, please note it down. Okay, if you just want to recall it and leave it, it's fine. Okay, so the problem is bone growth will be difficult. Here I want you to remember this particular damn important point. The main bones which will be impaired are going to be your long bones. Main bones which are affected will be long bones. Okay, the next one will be what? The next one will be very good, correct answer. Okay, long bones are impaired. The next point of view which you need to understand, this is a condition in which so fontanelles unnai kada, fontanelles are there, right? So fontanelles has to grow in the baby, right? That fontanelle closure will be delayed fontanelle closure. So automatically growth will be proper or impaired growth. Impaired growth. Okay, the next clinical feature is going to be what? Deformities such as genu-valgum and genu-varum. So these are the deformities associated with the knee joint. Then next problems what can be found? They asked one beautiful question. Okay, what happens to the calcium levels in the blood calcium levels, and also what happens to the phosphate levels? So understand, this is a extra, like we'll write it separately. There is a decrease of vitamin, which vitamin? D3. So if there is a decrease of vitamin D3, decrease of calcium absorption. If there is a decrease of calcium absorption, okay, decrease of calcium. If there is a decrease of calcium absorption, which will decrease the serum calcium, So if serum decrease the serum calcium, if serum calcium is decreased, automatically your parathyroid hormone will come. Okay, your parathyroid hormone will come, increase the calcium. So basically the now calcium becomes normal level. So if calcium becomes normal level, So parathyroid hormone will also increase the phosphorus. Okay. So basically, so serum calcium levels will be normal with slightly elevated amount of parathyroid hormone and slight elevation of phosphorus. Clear? Okay. Now let's go to the next one, vitamin E. Girls, come on, tell the answer. Vitamin E. Oh, all the varieties they will do, they'll take like, white oil, vitamin E capsule, they heat up the oil, they cool it down, put it, mix it, they'll apply, okay? While applying only, so much air will come in the hand. Okay, vitamin E is just so basically it is just a antioxidant. Okay, basically it prevents us from becoming an auntie and uncle. Okay, that is it is antioxidant. No, it is responsible for the removal of free radicals. Okay, free radicals. Okay, so free radicals will make us auntie and uncle. That is a direct statement because free radicals are responsible for aging. Okay, all right. Then let's go to the next one, vitamin K. Vitamin K is produced by which part of the body? Vitamin K is produced by microorganisms which are present in the intestine. Okay, it is responsible for the production of 2, 7, 9, 10. So very good, intestinal microflora. Very good, Sangeeta. You are absolutely correct. So vitamin K, when we are speaking, what is happening, guys? Vitamin K. So there is a factor 2, 7, 9, 10. So 2, 7, 9, 10 factor synthesis, that is clotting factor synthesis, requires vitamin K. Deficiency of vitamin K lead to decrease of 2, 7, 9, 10. So 2, 7, 9, 10, if they are not there, automatically will it cause the bleeding? Yes, it will cause the bleeding. And bleed, if it is there is a bleeding, there is no clot formation because clotting factors are absent. Okay, so that is why it is a coagulant or anticoagulant. It is responsible for clot formation. So what we will call it as a coagulant. It is called as coagulant. If it is preventing it from the coagulation, then we'll call it as anticoagulant. Vitamin K overdose antidote is what? Warfarin. Warfarin's antidote is vitamin K. All the important points about the fat soluble vitamins are done. Very good. So water soluble vitamin B1 is also called as Skajit Pajalusta. Vitamin A. Okay. Correct? రాసుకోండి రాయండి అలా రిటర్న్ ఫస్ట్ నిద్ర నుంచి రేయండి తూగట్లితే ఏందరింగా ఇట్ ఈస్ THIA. Okay, THIAMIN. Okay, thiamine. THYA is called as thiamine. That is a nucleotide. Okay, don't get confused. Vitamin K, I will tell once again quickly. So vitamin K is a vitamin which is responsible for the synthesis of clotting factor 2, 7, 9, 10. So they're responsible for clot formation. If vitamin K is not there, there is no clot formation, which will increase the tendency of bleeding. So vitamin K deficiency will be found in only in the newborns. Why newborns? Because newborns does not have a intestinal microflora. So that is why for every newborn we give vitamin K injection to prevent the hemorrhagic disease of the newborn. Okay, so then the next important aspect, overdose of vitamin K antidote is warfarin. Warfarin's antidote is vitamin. So we went into the water soluble vitamin, that is thiamine. Thiamine deficiency, there are two types of diseases which can occur. One is what? Beriberi. Okay, beriberi, and also one more is there. What is that? Wernicke's encephalopathy. So beriberi is divided into two types. Okay, सूखा वाला गीला वाला हिंदी वाला है ठीक है మళ్ళీ మీరు రాష్ట్రానికి తీసుకుపోతుంది. Okay, so what is that? That is your dry beriberi, wet beriberi involves the cardiovascular system. Okay, very good. Let's go to the next one, Wernicke's encephalopathy. Sir, Wernicke's encephalopathy, who will get? Wernicke's is seen with what? Mandubabulam, Mandubabulam. That is seen with alcoholics. So, alcoholics. What are the clinical features of Wernicke's encephalopathy? Global confusion. Okay. Open Okay, global confusion, ophthalmoplegia, and ataxia. Kindly please pay attention to this point, what I'm going to tell now. They will not give you the Goa direct. Okay, if they give us Goa directly, it's very easy. Global confusion, ataxia, and also ophthalmoplegia. If they give, we can answer it directly. But sometimes they will describe the symptom. While walking, there is a disbalance is there. That means ataxia. Understood? So that is how they will give us loss of balance. Okay. Then the person was confused with what he is speaking or whom he is speaking with. He was confused about time and date orientation. Okay. And he was having some pain in the eye, something like that. They'll give that time. It is called as ophthalmoplegia. So that is your Wernicke's encephalopathy. Wernicke's encephalopathy is seen with which group of people? Alcoholics. So Wernicke's encephalopathy is a condition which will be treated with which vitamin? Vitamin B1. Vitamin B1 is nowadays available in the form of both injection and as well as tablet. Okay. All right. Can I continue? మీరు అట్లా అనకండి అయ్యా నా జూనియర్ వాళ్ళు చాలా మంది ఉన్నారు. B1. Okay. Next, B2. What is vitamin B2 is also called as? Riboflavin. Riboflavin. Riboflavin deficiency exclusively leads to angular stomatitis, which is also called as chiliosis. Very good. Riboflavin, and it will lead to angular stomatitis. ఇక్కడ వస్తుంది. Okay, inflammation at the angles of the mouth. Okay, na? Next, B3. B3 is also called as nicotinic acid, which is also called as nicotinic acid. Okay. చెప్పండి ఇంకా నియాసినమైడ్ అట్టగారులే ఇప్పుడు చెప్తారు మా వాళ్ళు చెప్తారు. చెప్పండి అమ్మాయిలు. అది కాదు, మీరు ఆగండి, అబ్బాయిలందరూ ఆగండి. గర్ల్స్, టెల్ వేర్ డు వి యూజ్ నియాసినమైడ్? ఇప్పుడు ఆన్సర్ వస్తుంది. చెప్పండి ఏ బ్రాండ్ లో వస్తుంది కూడా చెప్తారు. కమాన్ గర్ల్స్, ప్లీజ్ డోంట్ డిసప్పాయింట్ మీ నౌ. అస్సలు చెప్పారా? ఇంకా మేమే చెప్తాంలేండి, మాకు తెలుసుగా. ఇట్ ఈస్ ఫౌండ్ ఇన్ మాయిశ్చరైజర్. మేము కూడా బయోకెమిస్ట్రీ చదువుకున్నాం. ఓకే, ఇట్ ఈస్ ఫౌండ్ ఇన్ వాట్? Moisturizers, niacinamide. But anyways, let's get back to the niacin. See, వచ్చింది ఆన్సర్. సో విచ్ బ్రాండ్ కూడా వస్తుంది కావాలంటే, ఇప్పుడు మినిమలిస్ట్ అని వస్తుంది చూడు. Okay, now listen to me very carefully. What is that I'm telling? Niacin. Niacin is a nicotinic acid. So niacin, first point I want you to understand. Guys, everyone tell me niacin is produced by which amino acid? Niacin is produced by which amino acid? Absolutely correct. The answer is very good. Mani and Sangeeta, if people are correct, all of you write down. It is coming from the tryptophan. What is the name of the amino acid? Tryptophan. Tryptophan nunchi we are also getting two other substances. What are the two other substances? 5-HT serotonin, and also we are getting melanin or melatonin. Melatonin. And it is also giving rise to one more substance, that is only your vitamin B3. Okay, all of you are absolutely correct. Ochronosis and chiliosis. Chiliosis is nothing but inflammation at the angles of the mouth. Ochronosis is a pigmentation. Color change agadana ochronosis. Okay. Ade, for example, inflammation irinda, we will call it as chiliosis. Literally swelling up. Okay. Understood, Akash? Adu ninga pronounce pandrappa paathu. Ochronosis. Okay. Okay, let's continue. Okay. So vitamin B3. Vitamin B3 deficiency can be caused as a result of tryptophan deficiency. Agree with me, everybody? Tryptophan deficiency leads to B3 deficiency. Yes. If tryptophan deficiency leads to B3 deficiency, automatically you people have to tell me if at all somebody develops a pellagra, that can be due to two causes. What are the two causes? Could be tryptophan deficiency, could be B3 deficiency. Okay. So in which type of diet it is very less amount, maize rich diet. Okay. So what are the clinical features? Ippudu cheppandi. Diarrhea, dermatitis, dementia, vadileste death. If you leave it, death. Okay. Now the main important point, along with that, they will give you Casal necklace. What is that? Casal's necklace are also called as Cahal necklace. Kajal den kaadu. Kaadu. Okay na? So let's go to the next one. B4. B4 unda leda? Ekkadiki ellindi? Bring it back. Where did B4 go? I have a valid question. Where did B4 go? Where did B8 go? Where did B10 and B11 go? They didn't go anywhere. Basically, when we are studying some structure, we might have found the intermediate structure between them, but we are not absolutely clear about their function and their structure. So that time we will leave out a place because so that it won't mess up with our classification in further life. Okay. So, but I'm praying that till we are doctors, I don't want any B8, I don't want any B10 and B11s. Okay. Already what I know, I have to update that it is going to be irritating. But anyways, B5 is called as pantothenic acid. Pantothenic acid, very good. Pantothenic acid deficiency leads to which disease? Burning food syndrome. It is a purely sensory symptom or sensory and motor symptom, sir? This is a very important question. It's pure sensory symptom. Pure sensory symptom. Okay, na? Which is also called as Grayson-Gopalan syndrome. ఇది ఎక్కడి నుంచి పట్టుకొచ్చారు సార్ పేర్లు ఇట్లాంటి ఎక్కడి నుంచి పట్టుకొస్తారు So actually Grayson-Gopalan syndrome is a generalized term we can say for all the types of like abnormal sensations in the field, in the feet. Gabgaba, Junjunati అన్నిటికీ ఓకేనా బట్ స్టిల్ యాజ్ సచ్ అదే ఒక జోక్ లే okay anyways so that is pure motor symptom or sensory symptom okay na? Let's go to the next one. B6 is also called as PP. What is that? Pyridoxyl phosphate. Pyridoxyl phosphate, the question will arise to us is what is that? That is the deficiency leads to which disease? The deficiency leads to which disease? Excessive of B6 lead to which disease? So, and before that, where will we get the deficiency? Deficiency is caused by alcoholism. One more alcoholism, and one more is there isoniazid. You should never do a mistake of this. Deficiency caused by alcohol and isoniazid. Very good. Absolutely correct, guys. Okay. Anti-TB drug, to be very specific, isoniazid. Okay. So what are the clinical features of vitamin B6 deficiency? Write down. If you have not written, it will lead to sideroblastic anemia. Sideroblastic microcytic. It can be two types. Microcytic also possible. Macrocytic also possible. But most commonly, what is the type of enzyme deficiency? Microcytic only. Sideroblastic microcytic anemia. And one more thing, what we are going to get is a peripheral neuropathy. It can also be associated with any of the other vitamin B symptoms along with the peripheral neuropathy. We will call it as what? Vitamin B6. So these clinical features are same in which disease? They are same in B9. Excess of B6 also. Some people will become masters of their own vitamin medications. So during that time also excessive or abnormal taking of B6 will also lead to the symptoms. B7 is also called as biotin. Biotin. Okay. So when we are speaking of biotin, Chapan Marinka, girls, tell me, Think about what is the answer? It is prevent the hair loss. But actually, that is not its function. But its deficiency, if in the body, if there is a deficiency, it can lead to hair loss. But for every hair loss, is it the treatment? Is it the treatment? Absolutely no. Please don't. Okay. So it can lead to alopecia, but this is not the treatment for every hair loss. Recent times in some Instagram ads, you might have seen. What is that Instagram ads are coming out to be? Diet adi kaadu. Biotin gum. You told, I heard it like diet. I'm sorry. Biotin gummies. Okay, na? If biotin gummies, actually, what is that? Biotin gummies are useful only if you have a biotin deficiency. Biotin deficiency generally seen with which type of population? Those who consume raw eggs. Raw egg consumption. Raw egg consumption people will have what? Biotin deficiency. Why biotin deficiency? Because raw eggs will contain a chemical named as avidin. Is the name of the chemical called as avidin. So this avidin chemical will prevent what, sir? It will prevent the absorption of B6, leading to what? Leading to vitamin B7 deficiency. What is B9, sir? Folic acid. Folic acid. Folic acid deficiency leads to which disease? So first thing, if it deficiency in the pregnancy, it will lead to neural tube defects in the baby. That neural tube defects in the baby will be, you need to remember, such as encephalocele, meningomyelocele, for example, right? Anencephaly, this will come. Okay. But the problem is neural tube defect can be prevented. Okay. So this is a very dangerous problem. And now in India, we are successfully preventing a lot of neural tube defects as much as possible. So to prevent this, you are going to get a question. When is the ideal time to start the folic acid for a woman?
Before 6 months.
3 to 6 months before the pregnancy. But 3 to 6 months before the pregnancy, sometimes it is not. Why? Because a female got married, within 2 months she is pregnant. So before the 6 months, if you want to give, the problem is 3 to 6 months. Okay, na? But the problem is 6 months when she was not planning about marriage only. Okay. Within that time, she got pregnant also. Now what to do? Now when they terminate the pregnancy. Hey, name Koshiko, Hindi. Okay. Now what you have to do is that first antenatal checkup. So start with the folic acid. Okay, na? So that will lead to what is that? Prevent the neural tube. If at all, if it occurs in an adult individual like us, it will lead to megaloblastic anemia. So if you want to look at a megaloblastic anemia, and if you do a blood parameter, blood lo em perigintadi raskoni mari cheppandi mari. What is that? Elevated level of homocysteine. What we discussed earlier. Elevated level of what? Homocysteine. Okay. Elevated level of homocysteine. Okay. So these are the important points about your beam. Okay. Folic acid is required for neural tube development. Okay. B12. B12 is responsible for what? So remember two important points. B12 is responsible for the myelin production. And also B12 is responsible for the production of something. What is that? నిన్ననే చెప్పిన మళ్ళీ మర్చి సో ఇంపార్టెంట్ నెట్కి మిథైల్ మైలినిక్ యాసిడ్ అలాగే సో ఇట్ ఈస్ రెస్పాన్సిబుల్ ఫర్ న్యూక్లియోటైడ్ సింథసిస్. Okay, so basically nucleotides, if they are there, what will happen? DNA will form. If DNA will form, what will happen? The cells from the bone marrow will replicate. Understood, everybody? Purida? Okay, because all this is written. Writing 10 times makes no sense. I'm recalling it. Now the point what I'm telling you is, if at all B12 is not there, automatically DNA formation is impaired. If DNA formation is impaired, automatically RBC replication will impair. That will lead to type of anemia such as aplastic, right? aplastic. Even if they're there, immature cells will come. That might lead to mainly which type of anemia? Megaloblastic anemia. So both B9 and B12 will lead to main type of anemia, that is only your megaloblastic anemia. Both of these diseases will lead to what? Megaloblastic anemia. So in all the type of megaloblastic anemias, we are going to get a condition called as hypersegmented neutrophils. Hypersegmented neutrophils. Hypersegmented neutrophils. Clear, everybody? So hypersegmented neutrophils. Just let me check if I have that. Along with that, I will just finish the pictures for the blood also. Is that okay for everybody? Sure. Online వాళ్ళు చెప్పండి. Online people, is it okay for you people also if I discuss the blood images? Let's take it. ఏం లేదు, బ్లడ్ పిక్చర్స్ చాలా గ్రేట్గా ఉన్నారనమాట. రక్తంలో ఓవర్ ఉన్నారు. ఇంకా డిస్కస్ చేద్దాం. విన్నాడు అనుకో చచ్చిపోతాడేమో ఆయన కదా. బాను విన్నాడంటే దెబ్బకి చచ్చిపోతాడేమో ఆయన. ఇప్పుడు బాను అనుకుంటుంటా, సార్ మీరు ఏందో చేస్తూ నన్ను ఎందుకు వేసుకుంటున్నారు, అది ముందే రికార్డ్ అవుతుంది. Okay, let's quickly recall all the images related to the blood, which are important. I'm not telling all the images, which are related to these things. చాలా సింపుల్. ఫస్ట్ ఇది తెలిసి ఉండాలి మనకి, ఈ పిక్చర్ పెరిఫెరల్స్ మీరు. Okay, we should know the peripherals. So when we are speaking of this, what is that? Neutrophil, eosinophil, basophil. How to recognize each one of them? Let's understand. So remember, eosin is a stain. Eosin is a आ रहा है 1 सेकंड रुकिए सर. Okay, guys. So eosin, whatever is there, right? Eosin is usually an orange color. Absolutely blue color. What is that? Basophilic. Okay. Absolute blue color is a basophilic. Absolute red or orange color, we will call it as a eosin. Okay. Remember, all the nucleus are the base. Okay. If you take any cell's nucleus, they are what? Base. Base will look which color? మీ ఇమాజినేషన్ కలర్లు చెప్పకండి, ఇక్కడ చెప్పండి. బేస్ విల్ లుక్ విచ్ కలర్? బ్లూ కలర్. బేస్ విల్ లుక్ విచ్ కలర్? బ్లూ కలర్. ఓకే, బేస్ విల్ లుక్ విచ్ కలర్? బ్లూ కలర్. So that is why all the nuclei will look extremely blue. Yes. So this much blue color, if it is there, we will call it as a basophilic in nature. Okay. So if you notice here, sir, among all these cells, there is an orangish tinge is present here. Orangish color is present. So if orange color is present, orange color means what? Eosin. Sir, in the eosinophil also, why it is blue color? Because as a rule, all the nuclei will look which color? Blue color. Anni cell nucleus le color la kanpistai? Blue color. Which color you are going to see them in? Blue color. So if there is a cytoplasm is orange color, then you will call it as a eosin. If the cytoplasm is extremely blue color, as in this case scenario, yes, can you see this? So then I will call it as a basophil, because anything which is basophil is a blue. Okay. If you find anything, the cytoplasm in between the orange and extreme blue, I will call it as a neutral color, called as a neutral. So if you look at that, okay, sir, monocyte, how do we differentiate, and lymphocyte? So in the neutrophil, there is a nucleus, but nucleus is one structure, or it is something like this? Yes. So nucleus is straightly present or segmented nucleus. Segmented nuclei usually found in neutron. Then how to differentiate between a lymphocyte and a monocyte? Nucleus, if it is bigger than the cytoplasm, usually it is a lymphocyte. Almost cytoplasm and nucleus of the same size, we will call it as what? Monocyte. అయిపోయిందా ఇంకా ఇటు సైడ్ లో ఉన్న బోనస్ సెల్స్ ఏంటి రెడ్ బ్లడ్ సెల్స్ ఇంతే పెరిఫెరల్స్ సో వాట్ ఈస్ దిస్ బాడీస్ ఎట్లా తెలుసు ఎక్స్ప్లెయిన్ ద రీజన్ కరెక్ట్ సో నౌ లిసన్ టు నీ ఫ్రెండ్స్ చాలా నిజం తీయడానికి అందరు కలిపి మీ ఫ్రెండ్స్ చాలా ఓకే నౌ లిసన్ టు మీ యూఆర్ అబ్సల్యూట్లీ కరెక్ట్ ఇదే కలర్ లో ఉంది నౌ టెల్ మీ ఆల్ ఆఫ్ యూ ఓన్లీ ఆన్సర్ బ్లూ కలర్ సో ఎనీ బ్లూ కలర్ థింగ్ ఇస్ ఎ basophil. Any blue color thing is a basophil. Any blue color thing is a basophil. And which structure in the cell is always extremely blue? Nucleus. So this is a RBC does not have a nucleus normally. Yes, physiologically does not. But nucleus remnants which are presenting towards the center. Then we will call it as what? Havel-Jolly body. Havel-Jolly bodies are what? Askund Mari. Nuclear remnants. వదిలేండి ఇది PDF ఇచ్చేస్తాను. I'll say share the PDF for everyone. Nuclear remnants. We will call it as what? Havel-Jolly body. When will nuclear remnants be present? Any case where there is a simple condition called as asplenia. What is it called? Asplenia. Means absence of the splenic function, such as splenectomy, such as sickle cell anemia, okay, splenic trauma, okay. During that time, the patient can develop which bodies? Havel-Jolly body. Now, this one is the H&E stain. No, it is not hemotoxin and eosin stain. Why it is not hemotoxin and eosin stain? Because there is nothing orange, there is nothing pink there. Yes. So it is basically it is a supravital stain. Okay. And if you notice, blue color bodies are being formed, but are they at the center or at the level of cell membrane? At the level of cell membrane. So in which condition cell membrane of the RBC will be interacting with the free radicals called as G6PD deficiency? G6PD deficiency. So what you are going to get are Haynes body. Where you are going to find G6PD deficiency. So what are these iron bodies are made out of? Nuclear remnants? No, they are not a nuclear remnants. What are they? Lipid peroxide bodies. What are they? Lipid peroxide bodies. Heinz bodies is again, I'm guessing or expecting this question. Lipid peroxide bodies. Idhen paristhiti. So if you notice in the center, it looks like a target for playing darts. Yes or no? We will call it as a targets. Target cells are seen with which condition? Iron deficiency, anemia, thalassemia. Okay, so basically you are looking at what? You are looking at a condition where there is a decrease of hemoglobin. If there is a decreased hemoglobin, automatically it will lead to what? Target cell formation. Let's go to the next one. This one. Teardrop RBC. Seen with which disease? Teardrop RBC. It's so. Can you look at the RBC? आंख के आंसू के बूंद जैसा नहीं है? Yes. Okay. So, how does it look like? It looks like a drop of a tear. So, it is seen with majority seen with the myelofibrosis. In which condition you are going to see it? Myelofibrosis. What is myelo means? Bone marrow. Fibrosis means bone marrow fibrosis. So if there is a bone marrow fibrosis, very good, correct answer, Sangeeta, myelofibrosis. So it is what? Bone marrow fibrosis. Bone marrow fibrosis, if it is there, when will this occur? Bone marrow fibrosis. Huh? So bone marrow fibrosis, see, simple logic. Fibrosis, wherever you hear a fibrosis, there is a damage. Damage led to healing, healing led to fibrosis. Gurtuntada? Damage led to healing. Healing led to fibrosis. Okay. So what will be the damage? Inflammation of the bone marrow. We will call it as a osteomyelitis. Osteomyelitis. Osteomyelitis complicate itself into MF, myelofibrosis. Okay, na? Ante, myelofibrosis. Let's go to the next one, spirocytes. So look at the RBC looking absolutely like a spears. So where do we find this spirocytes? HS, hereditary spherocytosis. So as you are already telling, what is the defect here? Ankyrin, spectrin, inkoti. Ankyrin, spectrin, and band 3. These are the proteins which are present on what? Band 3 protein. ఈ బ్యాండ్ ఎక్కడ బ్యాండ్ వేసి ఉండదు మా దాంట్లోనే ఉంటాయి. ఓకేనా? సో band 3 protein defect. Band 3 is what? Please understand kindly. These all 3 proteins, they are the structural proteins of the cell membrane of the RBC. So if they are defective, what will happen? More water can come inside, leading to bulging and swelling of the RBC. Let's go to the next image. That is only, what is this cell? Target cell. What is this cell? Target cell. So here we have one more cell which I want you to understand. This is bigger or smaller? Very bigger. Megaloblast. We'll call it as a megaloblast. So here what cells we have? A bite of the RBC has been taken out. Can you notice? Yes. So Haynes bodies were formed. Remember, if Haynes bodies will be removed, it will land up into bite cell. So Haynes bodies after removal will give rise to bite cell. Seen with the consi disease, ఏ disease లో వస్తాయి? G6PD deficiency. ఎందుకంటే Haynes bodies కూడా ఎక్కడ వచ్చాయి? G6PD deficiency. These are called as acanthocytes, abnormally shaped RBCs. ఇక్కడ ఏమున్నాయి? Arrow, look at that. So there is a sickle cell RBC seen with the sickle cell anemia. Okay, so that finishes the pictures related to your blood also. Where were we? Let's continue with our biochems rapid revision. Vitamin C, the last vitamin for the picture. So that is also called as ascorbic acid. Ascorbic acid is found in which type of foods? Citric fruit or a citrus fruits. Okay, ascorbic acid is responsible for the collagens post translation modification. Post-translational modification. So what is that post-translational modification? That is only, so I told you, remember in collagen there was a proline. Yes, proline will get converted into hydroxyproline. So the conversion of proline to hydroxyproline requires which vitamin? Vitamin C. Which vitamin is required? Vitamin C. So if there is a vitamin C deficiency, okay, hydroxylation of proline, absolutely correct. If there is a vitamin C deficiency, you are going to get a patient with the scurvy. Clinical feature చెప్పండి మళ్ళీ గట్టి చెప్పాలి అందరు. Tell me the clinical features of scurvy. Gums లో ఏమైతుంది? क्या होता है? If I am an examiner, bleeding gums. Without bleeding gums, I'll give all the other clinical features. So shall we look at those clinical features? First of all, collagen will be defective. Okay, so collagen is present in bones, yes or no? So in the bones, which bones? Small bones. Small bone developmental defect. So carpal bone defect. Ardhamainda, by looking at the bone also you can tell by looking at which bones are involved, you can understand vitamin D versus vitamin C. If he is talking about vitamin deficiency and carpal bones, it's possibly could be related to C. Possibly. Why? Because we have to look at that. So there can be rashes all over the body. So what are these rashes made out of, guys? What are these rashes made out of? So rashes are basically small bleedings. What are these? Small bleedings. Okay, carpal bone defects. Okay, rashes, slow wound healing. Slow wound healing. Then what else will be the slow wound healing? And then mainly I want you to remember these clinical features. Along with them, patient can have gum swelling and bleeding. That finishes your, what is that? Vitamins. Okay. So once we are done with the vitamins, we'll take a break for lunch. Okay. We will come back and do ఇంకా ఏమేమి ఉన్నాయి? లిపిడ్స్ కార్బోహైడ్రేట్స్ అంతేనా? బాగా చేసినాం. Okay, guys, take the break for the lunch and we will come back. So now it is 1:45. 2:30 lunch break till 2:30. Solve.